Okay, we'll start with the upper limb. (2026) स्टार्ट होगा एंड ऑफ सितंबर और बिगनिंग ऑफ अक्टूबर, एंड ऑफ सितंबर और बिगनिंग ऑफ अक्टूबर. ठीक है. So बच्चों, this is the free lecture, this is the revision lecture, a quick go through the upper limb. ठीक है, एक quick go through करेंगे upper limb से. PYQs नहीं बच्चे, PYQs नहीं. PG प्रिपरेशन के लिए अलग लेक्चर्स है. There are some different lectures. Hello, am I audible? There are some different lectures for PG preparation. PW Meded for Prarambh batch is for first year. Am I audible now? सोहर, जो मेडेड के लेक्चर्स हैं, PW मेडेड प्रारंभ बैच के लेक्चर्स हैं, दैट इज फॉर फर्स्ट ईयर MBBS. जो रैपिड रिवीजन के लेक्चर्स हैं, दैट इज फॉर नीट PG, दैट इज फॉर नीट PG. ठीक है. फाइन, विल स्टार्ट करते हैं. ऑडियो वॉल्यूम, गुड इवनिंग गुड इवनिंग गुड इवनिंग. ऑडियो वॉल्यूम तो है, काफी है. ठीक है. फॉर इज फॉर रिवीजन, देयर आर ऑन. चलो विल स्टार्ट. हाय राहुल, विल स्टार्ट. एक क्विक गो थ्रू है, वी हैव ऑलरेडी सीन एवरीथिंग. अभी एक क्विक गो थ्रू है. ओके, आई एम स्टार्टिंग. लुक एट दिस मसल. ये मसल पेक्टोरलिस मेजर. पेक्टोरलिस मेजर शॉर्ट नोट आता है. Origin of pectoralis major, that's fine students. I'm starting now. अब सुनो, do not type anything. Okay, just sit back and understand. ठीक है, सब कराते हैं. अभी ये देख लो. चलो, muscle is pectoralis major, short note आता है. Origin of pectoralis major, yes, the medial 2/3 of the clavicle, the manubrium and the body of the sternum, the 2nd to 6th costal cartilages and external oblique aponeurosis. This is a quick go through lectures. एक revision lecture है ये, बस सुन लो. So origin of pectoralis major, it begins from the medial 2/3 of the clavicle, half the breadth of manubrium and the body of the sternum, the 2nd to 6th costal cartilages and the external oblique aponeurosis. ठीक है. Where is the insertion of this muscle? Insertion कहाँ पे होता है? Insertion of this muscle is on the lateral lip of the bicipital groove. Just one moment. Okay, insertion is on the lateral lip of the bicipital groove. What is the action of this muscle? जब pectoralis major contract होगा, so what will it do? It will take the arm towards the body. ये क्या होगा? Adduction. It will take the arm forwards. ये क्या होगा? Flexion. And third is medial rotation. So adduction, flexion and medial rotation at the shoulder joint. Nerve supply of pectoralis major. Anyone? Nerve supply of pectoralis major is medial and the lateral pectoral nerves. कोई भी मसल है जिसको ड्यूअल नर्व सप्लाई होता है, a muscle having a dual nerve supply is known as a hybrid or a composite muscle. Hybrid और composite muscle. सब लोग देख सकते हो लेक्चर्स, बस सुन लो. नाउ डोंट टाइप एनीथिंग. ठीक है, दैट्स अबाउट द पेक्टोरलिस मेजर. अब जैसे पेक्टोरलिस मेजर को निकाल देते हैं, ओके, यू विल सी दिस फेशिया. ये फेशिया कौन है? क्लैविपेक्टोरल फेशिया. शॉर्ट नोट आता है बच्चों क्लैविपेक्टोरल फेशिया पे. MCQs आते हैं क्लैविपेक्टोरल फेशिया पे. वेयर डज दिस फेशिया बिगिन फ्रॉम? It lies below the pectoralis major. कहाँ से शुरू होता है? It begins from the clavicle. It is inserted into the axilla. Begins from the clavicle, inserted into the axilla. दो muscles को enclose करता है ये. It encloses two muscles. Number one is the subclavius and number two is the pectoralis minor. Subclavius and pectoralis minor. Fine. Structures piercing the clavipectoral fascia. Yes. Now you answer. बोलो. Structures piercing the clavipectoral fascia. Number one. Answer this. Clavipectoral fascia को draw करना है. How do we draw this? One moment. Clavipectoral fascia को draw करना है तो you can draw this like this. ये clavicle हो गया. This is the clavipectoral fascia. ये muscle है subclavius. It comes down. ये दूसरा muscle होगा pectoralis minor and then it is inserted into the axilla. इसे क्या बोलते हैं? व्हाट इज दिस नोन एज? दिस इज व्हाट वी कॉल एज द सस्पेंसरी लिगामेंट ऑफ एक्सिला. सस्पेंसरी लिगामेंट ऑफ एक्सिला. Structures piercing the clavipectoral fascia. Number 1 is the cephalic vein. Cephalic vein. बेसिक से नहीं है बच्चे, दिस इज नॉट बेसिक, दिस इज अ फरे लेक्चर, दिस इज द रिवीजन लेक्चर बच्चों, दिस इज अ रिवीजन लेक्चर. ठीक है, जिनको बेसिक्स पढ़ना है वो बाद में आई विल टेक अदर बैच. सो स्ट्रक्चर्स पियर्सिंग द क्लैविपेक्टोरल फेशिया. नंबर 1 cephalic vein. Number 2 is the thoracoacromial artery. Number 3 is the lateral pectoral nerve. And number 4 is lymphatics from the breast. Lymphatics from the breast. ये याद रखना बच्चों, बहुत इंपॉर्टेंट है, MCQs में आता है. Cephalic vein, thoracoacromial artery, lateral pectoral nerve, lymphatics from the breast. Very good. Structures piercing the clavipectoral fascia. 2 घंटे में we have to revise the upper limb. बच्चों, this is a revision lecture. Furry is a revision lecture. हाँ, just sit back and listen. Detail lecture प्रारंभ बैच के लेक्चर्स होंगे, बाद में करेंगे वो डिटेल्ड लेक्चर्स. अभी ये रिवीजन लेक्चर है फॉर द एग्जाम गोइंग स्टूडेंट्स. ठीक है, मेनली. फाइन. सो दैट्स द क्लैविपेक्टोरल फेशिया, दैट्स अ cephalic vein, that's a thoracoacromial artery, lateral pectoral nerve and lymphatics होंगे. Okay. Now coming to this muscle. चलो, we'll start with this muscle, a very important muscle. This is the deltoid. Deltoid. Now you tell me, what is the origin of deltoid? Deltoid is a multipinnate muscle. शॉर्ट नोट आता है deltoid पे. Yes, very good, very good. शॉर्ट नोट आता है deltoid पे. Origin, insertion, nerve supply, action. अगर शॉर्ट नोट आता है तो origin, insertion, nerve supply, action लिखना है. And then अरे Doraemon, you can listen to the lecture. I've told you, no, do not keep on asking again and again. अभी बोल दिया ना, you can listen to the lecture. Listen now. Okay, now this deltoid multipinnate muscle होता है. What is the origin of deltoid? वैसे 3 fibers है deltoid के. 3 fibers which are this are the anterior fibers, this are the posterior fibers. ये होंगे posterior fibers. And what are these fibers? What are these fibers? These are the acromial fibers. Acromial fibers. So anterior fibers are the clavicular fibers. Posterior fibers begins from the spine of the scapula, and the acromial fibers begins from the acromion process. Acromion process. Fine. Now, this deltoid, where is the insertion of deltoid? Insertion of deltoid is on the deltoid tuberosity. Deltoid tuberosity of the humerus. ठीक है. So 3 origin है उसके. Anterior fibers begins from the clavicle. The lateral fibers or the acromial fibers begins from the from where? Yes, the acromial fibers begins from. Just one moment. I'll just. Okay, so anterior fibers begins from the clavicle, the posterior fibers begins from the spine of the scapula, the acromial fibers begins from the acromion process. Insertion is on the deltoid tuberosity of the humerus. ठीक है. What is the action of this muscle? हाँ, practical के लिए separate लेंगे एक lecture separate for practicals. This is only for theory. ठीक है. What is the action of this muscle? So anterior fibers क्या करते हैं? Anterior fibers करते हैं flexion and medial rotation. Posterior fibers करते हैं extension and lateral rotation, and acromial fibers does abduction from 15 to 90 degrees. Abduction from 15 to 90 degrees. These are acromial fibers. What is the nerve supply of deltoid? चलो बच्चों, अभी बोलो. What is the nerve supply of deltoid? Very good, very good. Shriom. Nerve supply of deltoid, anyone? बीच में I'll ask you questions, so answer those. Nerve supply of deltoid is. Yes. हाँ, no, you have to be very specific. Richa, anterior fibers flexion, posterior fibers extension, lateral acromial fibers does abduction. Nerve supplies axillary nerve. Axillary nerve supplies the deltoid and the teres minor, and axillary nerve एक cutaneous branch देती है जिसका नाम है upper lateral cutaneous nerve of arm. Upper lateral cutaneous nerve of arm. Axillary nerve supplies the deltoid, teres minor, and gives a cutaneous branch जिसका नाम है upper lateral cutaneous nerve of arm. Upper lateral cutaneous nerve of arm. Only anterior fibers difficult है, paralysis वैसे नहीं होता. Now, if the deltoid is paralyzed, Sachin, anterior fibers exceptionally paralyzed नहीं होते, the entire muscle gets paralyzed. ठीक है. So now you tell me, Okay, just wait. If the deltoid is paralyzed, what happens? It becomes a flat shoulder. Flat shoulder. ये जो shape है shoulder का, what is this known as the contour of the shoulder? If this contour is lost, ये shape of the shoulder is lost, it becomes a flat shoulder. Flat shoulder. अगर axillary nerve damage होती है, deltoid is paralyzed, shoulder becomes flat. Second, there's a loss of sensations on the upper lateral aspect of the arm. इसे हम बोलते हैं regimen batch sign. Very good, regimen batch sign, right? So that's about the deltoid. एक डायग्राम ड्रॉ करना है आपको, ओरिजिन, इंसर्शन, नर्व सप्लाई, एक्शन लिखना है, थोड़ा सा क्लिनिकल एनाटॉमी लिखना है. श्रगिंग ऑफ शोल्डर्स नहीं, श्रगिंग ऑफ शोल्डर इज नॉट द एक्शन ऑफ डेल्टॉइड, इट्स द एक्शन ऑफ ट्रेपेजियस. ठीक है, ओके, वेरी गुड, फाइन है. तो क्लिनिकल में फ्लैट शोल्डर लिखना है एंड रेजिमेंट बैच साइन लिखना है. ओके, एंड डेल्टॉइड इज पैरालाइज्ड इन Erb's paralysis. Deltoid is involved in Erb's paralysis also. ठीक है, so that's about the deltoid. Now coming to the next muscle. बच्चों ये क्विक रिवीजन है, आपने पूरा साल पढ़ा है तो जस्ट अ क्विक गो थ्रू, ऐसे रिवाइज करना है आपको एग्जाम्स में, एग्जाम्स के पहले. So serratus anterior, origin of serratus anterior, it begins from Krishna, this is the revision lecture. Yes, intravenous injection nahi, intramuscular injections are given in the lower half of the deltoid. Intramuscular injections are given in the lower half of the deltoid. Krishna, basics, if you are a new student, this lecture just sit and listen, basics se padhna padega. This is the revision lecture, fine. Okay, now coming to the serratus anterior. Serratus anterior ka origin is from the lateral aspect of the upper 8 ribs. Lateral aspect of the upper 8 ribs as digitations. Lateral aspect of the upper 8 ribs as digitations. Insertion, upper 8 ribs. Insertion of serratus anterior. Yes, where is the insertion of serratus anterior? On the costal surface of the scapula, medial border. Costal surface, medial border. Scapula आपको याद है? Scapula, okay, if that's a scapula like this, ये है coracoid process, ये है acromion process. So, where is the insertion of serratus anterior? यहाँ पे होता है. Costal surface, medial border. Costal surface, medial border. ठीक है. What is the action of serratus anterior? Look, costal surface, medial border, upper 8 ribs से origin होता है. What is the action of serratus anterior? Lower lateral is a branch of radial, बच्चे. Lower lateral is a branch of radial. ठीक है. हाँ, what is the action of serratus anterior? It pulls the scapula forwards. It pulls the scapula forwards. जब आप boxing करते हो और when you push, the scapula goes forwards. What is this action known as? Anyone? What is this action known as? Yes? What is the action of serratus anterior? Serratus anterior जब contract करता है, the scapula goes outwards along the chest wall. Retraction नहीं बच्चे, retraction नहीं. That is not retraction. That is protraction of scapula. Correct? That's protraction of scapula. जब भी अपन push करते हैं, the scapula goes forwards. This is protraction of scapula. हाँ, retraction is when the scapula is brought back to its normal position. वो होता है retraction of scapula. हाँ, so it is known as a boxer's muscle. It is known as the boxer's muscle. Very good. अब जब ये serratus anterior paralyzed होता है, when the serratus anterior is paralyzed, the medial border of the scapula becomes prominent. हाँ, medial border of scapula becomes prominent. इससे हम बोलते हैं winging of scapula. Winging of scapula. वैसे winging of scapula, yes, winging of scapula is because of two muscles. Paralysis of two muscles cause winging of scapula. One is trapezius एंड दूसरा है serratus anterior. दो मसल्स अगर पैरालाइज होता है तो विंगिंग ऑफ स्कैपुला होता है. एक है trapezius, दूसरा है serratus anterior. नाउ हाउ डू यू डिफरेंशिएट? ये मैंने बोला आपको लेक्चर्स में भी. हाउ डू यू डिफरेंशिएट वेदर दिस इज पैरालिसिस बिकॉज ऑफ trapezius या serratus anterior? बोलिए. हाँ, वेरी गुड, बहुत अच्छा आंसर कर रहे हो, दूसरा एक्शन ऑफ serratus anterior इज ओवरहेड abduction. यस, ओवरहेड abduction. वेरी गुड. विंगिंग ऑफ स्कैपुला. हाँ, सो विंगिंग ऑफ स्कैपुला एट रेस्ट, मतलब बंदा ऐसे ही बैठा है, विंगिंग ऑफ स्कैपुला है, सो दैट इज बिकॉज ऑफ ट्रेपेजियस. सी, द आर्म इज एट रेस्ट, कुछ मूवमेंट नहीं हो रहा है, एंड दिस अ विंगिंग ऑफ स्कैपुला, सो दिस इज बिकॉज ऑफ पैरालिसिस ऑफ ट्रेपेजियस. एंड विंगिंग ऑन अटेम्प्टिंग मूवमेंट, जब कोई मूवमेंट परफॉर्म कर रहा है एंड दिस अ विंगिंग, सो दिस इज ड्यू टू पैरालिसिस ऑफ serratus anterior. Very good. Yes, all of you can watch this lecture. Just sit back, relax and listen to the lecture. खुश, सुनो लेक्चर, ठीक है, फाइन, ओके। एब्डक्शन ऑफ द शोल्डर जॉइंट, ये शॉर्ट नोट आता है ये शॉर्ट नोट आता है, एब्डक्शन ऑफ द शोल्डर जॉइंट, बोल सकते हो? कम ऑन बच्चों, आंसर दिस, एब्डक्शन ऑफ द शोल्डर जॉइंट। चैप्टर नेम इज अपर लिम्ब, द टॉपिक इज पूरा अपर लिम्ब, दिस इज द रिवीजन लेक्चर, कम ऑन स्टूडेंट्स, एब्डक्शन ऑफ द शोल्डर जॉइंट, आंसर दिस। ये पूछता है, वाइवास में भी पूछता है, एमसीक्यू में भी आता है। विल स्टार्ट 0 to 15 डिग्रीज, इसे हम बोलते हैं इनिशिएशन ऑफ एब्डक्शन। इनिशिएशन ऑफ एब्डक्शन इज डन बाय, यस, supraspinatus, supraspinatus. 15 to 90 degrees, 15 to 90 degrees is done by acromial fibers of deltoid, acromial fibers of deltoid. And 90 and above, इसे हम बोलेंगे overhead abduction, overhead abduction. This is done by trapezius, serratus anterior and lateral rotation of scapula. Very good. So 0 to 15, yes, Shriyom, 0 to 15 supraspinatus, 15 to 90 is deltoid and 90 and above, इसे हम बोलते हैं overhead abduction. This is done by trapezius, serratus anterior and lateral rotation of scapula. Lateral rotation of scapula. Very good. Very good. ये याद रखना. चलो, we'll start with the axilla. Revision हो रहा है ना? This is how you should revise, huh? Okay. Okay. Now this area is the axilla. Very good, very good. So now we're starting with the axilla. अब ये जो area आप देख रहे हो, this area is the axilla. ये area axilla. So what are the boundaries of axilla? ये होगा anterior wall of axilla, पीछे होगा posterior wall of axilla, ये होगा medial wall and ये होगा lateral wall of axilla. Okay. So anterior wall of axilla, शिवम सुन लो, एंटीरियर वॉल ऑफ एक्सिला कैसे बनता है? नंबर 1, ये कौन है? पेक्टोरलिस मेजर। पेक्टोरलिस मेजर के नीचे क्या होगा? पेक्टोरलिस माइनर। एंड तीसरा मसल होता है क्लैविकल के नीचे, व्हाट इज दैट? सबक्लेवियस, सबक्लेवियस। सो अगर एक्सिला एलएक्यू आता है, सो फर्स्ट लिखोगे बाउंड्रीज ऑफ एक्सिला। So anterior wall of axilla is formed by pectoralis major, pectoralis minor and subclavius, subclavius. So pectoralis major, pectoralis minor and the subclavius. Posterior wall of axilla. So this is pectoralis minor and this is the subclavius. Okay, that's a subclavius. Subclavius, ठीक है? So anterior wall of axilla is formed by pectoralis major, pectoralis minor and the subclavius. अब चलते हैं posterior wall of axilla. Posterior wall of axilla is formed by number 1. ये मसल कौन है? Identify this muscle. This is number 1. हाँ, identify this muscle. This is number 2. And एक तीसरा मसल आएगा पीछे से, which gets inserted into the bicipital groove, which goes into the bicipital groove of the humerus. ये क्या मसल होगा? Anyone? What is this muscle? This is number 3. So the posterior wall of axilla is formed by number 1 has subscapularis. Very good. Akshat, number 1 is the subscapularis. Number 2 is the teres major, and number 3 is the latissimus dorsi. Number 3 is the latissimus dorsi. Very good. Shoni. Very good. तो ये practical के लिए useful होगा. Fine. So the posterior wall of axilla कैसे बनता है? Number 1 is the subscapularis, number 2 is the teres major and number 3 is the latissimus dorsi. ये सब MCQs में आता है. Fine, this also comes in theory. Okay, so anterior wall clear है, posterior wall clear है. Now the medial wall of axilla, medial wall, see, this is the posterior wall. What is this muscle? ये identify करो. What is this muscle? I'll put a star here. This muscle is climber's muscle. Climber's muscle. This is a very big muscle. Begins from the iliac crest, begins from the spines of the thoracic vertebrae, lumbar vertebrae, and begins from the iliac crest. And this muscle goes and gets inserted into the bicipital groove. This is the latissimus dorsi. Latissimus dorsi. Okay. So posterior wall of axilla is formed by, यहाँ पे एक muscle होगा subscapularis. This is 1, this is 2, teres major, and number 3 is the latissimus dorsi. Very good. Medial wall of axilla is formed with the ribs and the serratus anterior. Very good. The ribs and the serratus anterior. And the lateral wall would be formed by the humerus. Lateral wall will be formed by the humerus and एक muscle होता है which begins from the coracoid process to the humerus. बोल सकते हो ये कौन है muscle? The lateral wall is formed by the humerus and एक muscle होता है which begins from the coracoid process to the humerus. बोलो, name of the muscle. Coracoid process to the humerus. Come on, बच्चों, come on, answer. Coracoid process to the humerus. Name of the muscle. Yes, very good, Akshat. Very good, very good. Shriyom. Which is that muscle? वो muscle कौन है जो coracoid process से humerus तक जाता है? Coracobrachialis. Very good, coracobrachialis. So बच्चों, axilla is clear. Anterior wall of axilla is formed by pectoralis major, pectoralis minor, subclavius. The posterior wall is formed by subscapularis, teres major, latissimus dorsi. The medial wall is formed by the ribs and the serratus anterior. The lateral wall is formed by humerus, the coracobrachialis, yes, and shorted of biceps लिख सकते हो. Fine. So this is the axilla. Okay, very good. Now you tell me. एक slide draw करता हूँ फटाफट. एक slide draw करता हूँ. Just 2 minutes. That's the manubrium sterni. That's the body of the sternum. This is the clavicle. ये है scapula. ये होगा first rib. That's the humerus. Fine. So ये है axilla. This is the axilla. What is this for the axilla? इसे क्या बोलते हो? That's the apex of the axilla. Apex of the axilla. And the apex of the axilla, इसके boundaries क्या होते हैं? आगे है clavicle. Anteriorly is the clavicle. Posteriorly is the scapula. Medially is the first rib. First rib. This is what we call as the apex of the axilla. This is what we call as the cervicoaxillary canal. Cervicoaxillary canal. ठीक है बच्चों? Okay. Now, if you can tell me this is the arch of aorta. ये होगा अपना subclavian artery. Subclavian artery crosses the first rib. First rib को जैसे ये cross करता है, now it becomes the axillary artery. The axillary artery enters the apex and comes into the axilla. ये axilla में आ गया. So contents of axilla क्या होगा? Number 1, axillary artery, axillary vein, the brachial plexus, the axillary pad of fat, and the axillary lymph nodes. So बच्चों, now just try to understand. एक मिनट, just try to understand. So anterior relations of axillary artery क्या होगा? Anterior relations of axillary artery क्या होगा? The muscles which forms the anterior wall of axilla. जो muscles anterior wall of axilla बनाते हैं वो बनेंगे anterior relations of axillary artery. So pectoralis major, pectoralis minor. ठीक है? So ये बनेंगे anterior relation. Axillary artery is lying on what? It is lying on the posterior wall of axilla. तो posterior relation of axillary artery क्या होगा? Subscapularis, teres major, latissimus dorsi. हाँ, axillary tail of Spence भी होता है. Yes. Vikram, how are you? How are you? Yes. Yes, very good. So, posterior relation of axillary artery क्या होगा? Subscapularis, teres major, and the latissimus dorsi. ठीक है? So ऐसे याद रखना है. And then brachial plexus होगा उसके साथ. Brachial plexus, that we'll see. हाँ, अपन देखते हैं. हाँ, ठीक है. So ये हो गया axillary artery. So clear with the axilla. Axilla के boundaries clear है. Anterior wall, posterior wall, medial wall, lateral wall, apex of the axilla. Contents of the axilla होगा axillary vessels, the brachial plexus, the axillary pad of fat, the lymph nodes, and the axillary tail of Spence. Very good. Very good. सबका preparation अच्छा है. Very nice. Okay, now you tell me, what is this muscle? ये कौन है? ये है coracoid process. And what is this muscle? Sorry. ये है pectoralis minor. ये है pectoralis minor. ये है medial lip, lateral lip, which is a muscle inserted on the medial lip of the bicipital groove. ये क्या muscle होगा? This is the teres major. Teres major, and this is the pectoralis minor. Pectoralis minor. So now you tell me, what is this part of the axillary artery? ये होगा first part, ये होगा second part, ये होगा third part. ठीक है? And what is this artery now? ये बन गया अपना brachial artery. So axillary artery अगर short note आता है, so axillary artery is a continuation of what? It's a continuation of subclavian artery at the outer border of the first rib. So axillary artery is a continuation of the subclavian artery at the outer border of the first rib. The axillary artery enters into the apex, comes into the axilla at the lower border of teres major. At the lower border of teres major, It continues as, yes, yes रियोम कुछ डाउट्स है तो बोलो, ठीक है. Okay, it continues as brachial artery. Yes, it continues as brachial artery. So at the lower part of teres major, it continues as the brachial artery. बच्चों, you should be able to recollect an answer. आपने पढ़ा है सब, ठीक है? This axillary artery is divided into three parts by the pectoralis minor muscle. ये pectoralis minor divides the axillary artery into three parts. First part, second part, third part. चलो, who's on the medial side? Medial side पे vein होती है ना? Medial side पे कौन होती है? Vein. ये vein होती है. Now tell me the branches of the axillary artery. बोल सकते हो बच्चों? Branches of axillary artery. First part, second part, third part. Come on, students. The question is open to you. बोलो. Branches of axillary artery. First part, एक branch. Second part के दो branches. Third part के तीन branches. So branches from the first part, superior thoracic artery. Superior thoracic. Second part, lateral thoracic and thoracoacromial artery. Lateral thoracic and thoracoacromial artery. And third part के तीन branches, anterior circumflex humeral, posterior circumflex humeral and subscapular. Subscapular. हाँ ऋषभ, फर्स्ट पार्ट सुपीरियर थोरैसिक, सेकेंड पार्ट बोलो. यस अक्षत, फर्स्ट पार्ट सुपीरियर थोरैसिक, सेकेंड पार्ट याद आ रहा है? Second part is lateral thoracic and thoracoacromial. Lateral thoracic and thoracoacromial. I'm looking at your answers. Lateral thoracic and thoracoacromial. Yes, and third part के branches, anterior circumflex humeral, posterior circumflex humeral and subscapular artery. Subscapular artery. Fine बच्चों? हाँ, okay. Okay, fine. Now we come to the brachial plexus. चलो. So axillary artery is fine. इतना आपको लिखना है axillary artery के बारे में, branches लिखना है. Okay, and now we'll start with the brachial plexus. Brachial plexus start करते हैं. We'll start with the brachial plexus. Okay, now you tell me what is a plexus? Plexus कैसे बनता है? Very good, very good. सबने आंसर किया. How's a plexus formed? अभी देखो, now you'll be able to understand it better. चलो एक section लेते हैं. What is this? You tell me. What is this? What is this? ये जो slide में हमेशा draw करता हूँ. What is this? Yes, if anyone can answer this. ये spinal cord का section है. This is the dorsal root. This is the ventral root, and that's a spinal nerve. Spinal nerve. Okay, dorsal root, ventral root, spinal nerve. The spinal nerve divides into, yes, it divides into two. एक होगा dorsal ramus and एक होता है ventral ramus. So now you tell me, बच्चों, what is a plexus? Plexus is a group of nerves. It's a network of nerves. Network of nerves. So how is a plexus formed? A plexus is always formed by the ventral ramus of the corresponding spinal nerve. Ventral ramus of the corresponding spinal nerve. ये spinal nerve है. ये डॉर्सल रूट हो गया, वेंट्रल रूट हो गया, ये डॉर्सल हॉर्न है, ये वेंट्रल हॉर्न है. डॉर्सल हॉर्न से डॉर्सल रूट आ गया, वेंट्रल हॉर्न से वेंट्रल रूट. दैट्स अ स्पाइनल नर्व. द स्पाइनल नर्व डिवाइड्स इनटू अ डॉर्सल रेमस एंड अ वेंट्रल रेमस. द वेंट्रल रेमस से बनेगा प्लेक्सस. सो वेंट्रल रेमस ऑफ द सर्वाइकल स्पाइनल नर्व से बनेगा सर्वाइकल प्लेक्सस. Ventral rami of C5 to T1 से बनेगा brachial plexus. The ventral rami of the lumbar spinal nerve से बनेगा lumbar plexus. And the ventral rami of the sacral spinal nerve से बनेगा sacral plexus. How is a plexus formed? A plexus is formed by the ventral ramus of the corresponding spinal nerve. So now you tell me, बच्चों, what happens in thorax? Thorax में कोई plexus नहीं होता. There is no plexus in the thorax. So what will happen to the ventral ramus of a thoracic spinal nerve? Come on, can you answer this? What happens to the ventral ramus of a thoracic spinal nerve? Thorax में plexus नहीं होता. So what will happen to the ventral ramus of a thoracic spinal nerve? Yes, you can guess, you can answer. सोचो. The ventral ramus of a thoracic spinal nerve. Yes. Nahin, Rishabh. The ventral ramus of a thoracic spinal nerve runs in the intercostal space and उसी को हम बोलते हैं intercostal nerve. Intercostal nerve. हाँ, so ventral ramus of thoracic spinal nerve है intercostal nerve. So अगर आपको पूछा गया what is an intercostal nerve, so आप बोलोगे intercostal nerve is the ventral ramus of a thoracic spinal nerve. वहां पे plexus नहीं होता. In the rest of the areas, this ventral ramus forms the plexus. Fine. Okay. So now let us understand the brachial plexus. Brachial plexus. So how is a brachial plexus formed? This is C5, C6, C7, C8, and T1. What are these? These are the ventral rami. Ventral rami of C5 to T1. इसे हम बोलेंगे roots. Roots. Roots will join to form the trunks. Trunk will divide into divisions. Division से बनेगा cords. And the cords will form the nerves. Nerves or the branches. Fine. So now we'll start. C5, C6, C7, C8, T1. अगर C4 takes part in the formation of brachial plexus, उसे क्या बोलोगे? Prefixed. Prefixed. Normal brachial plexus कैसे बनता है? C5 to T1 ventral rami. Ventral rami of C5 to T1. अगर C4 part लेता है, it is known as prefixed. Hi Shambhu, prefixed. If T2 takes part, it is known as postfixed. Right? T2 अगर participate करता है, it is known as postfixed. Fine. So let us start now. C5, C6 joins to form. Yes, what is this? Upper trunk. ये बनता है upper trunk. C7 से बनेगा middle trunk. C8 and T1 से बनेगा lower trunk. Okay. So C5, C6. Yes. हाँ. Ovia. So C5, C6 upper trunk. C7 continues as middle trunk. C8 and T1 joins to form the lower trunk. Now each of these trunks will divide into a dorsal and ventral divisions. यह है dorsal division, इसे posterior division भी बोलते हैं, and this is the ventral or the anterior division. So each of this trunk divides into dorsal ventral divisions. Now the ventral division of the upper trunk and the ventral division of middle trunk joins to form the lateral cord. Okay, so ventral division of upper and middle trunk से बनेगा lateral cord. Ventral division of, hi good evening, ventral division of lower trunk से बनेगा medial cord. Medial cord. And the dorsal division of all the three trunks joins to form what? Posterior cord. Posterior cord. बस ये है brachial plexus. That's a brachial plexus बच्चों. Araksh. Very good. Araksh. Fine. So how is the lateral cord formed? Lateral cord is formed by the joining of the ventral divisions of the upper and middle trunk. वो बन गया lateral cord. The ventral division of lower trunk से बना medial cord, and the dorsal division of all the three trunks joins to form the posterior cord. ये diagram आपको draw करना है. Even if you draw this diagram, that's more than enough. More than enough. अब इसकी root value देखिए. Root value. What is the root value of upper trunk? This will be C5, C6. Middle trunk होगा C7. Lower trunk होगा C8, T1. So what is the root value of lateral cord? Lateral cord का root value क्या होगा? C5, C6, C7. Medial cord का root value क्या होगा? C8 and T1. And posterior cord का root value होगा all the roots C5 to T1. C5 to T1. Fine है बच्चों, this is how the brachial plexus is. And this brachial plexus is related to what? The axillary artery. This will be related to the axillary artery. ठीक है? So brachial plexus में भी relations में आपको लिखना है axillary artery के relations with the brachial plexus. And axillary artery you have to write about the brachial plexus. Okay, just tell me one thing. Where do we get the cords? Cords कहाँ पे मिलते हैं? And nerves. Nerves बोल सकते हो? What are the nerves? Or the branches? What are the branches of lateral cord? चलो, we'll finish this. Branches of lateral cord. Nerves are the branches. So branches of lateral cord. Anyone? Come on, you can answer this now. Branches of lateral cord of the brachial plexus. Yes, Richa. What are the branches of lateral cord? Number one, lateral pectoral nerve. Number two, the lateral root of median nerve. And number three is the musculocutaneous nerve. Lateral pectoral, lateral root of median nerve, and musculocutaneous nerve. Very good, very good, very good. हाँ विक्रम. Which year? अभी कौन से year में हो विक्रम? I remember you attending the lectures. Yes. What are the branches of medial cord? Branches of medial cord. Number one is the medial pectoral nerve, the medial root of median nerve, the medial cutaneous nerve of arm, the medial cutaneous nerve of forearm, and ulnar nerve. Ulnar nerve, right? So medial pectoral, medial root of median nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and ulnar nerve. बस ये याद रखना है आपको. You have to remember this, right? And what are the branches of posterior cord? Posterior cord के branches: upper subscapular, lower subscapular, axillary, nerve to latissimus dorsi, and radial nerve. Radial nerve, 5 branches है. So upper subscapular, lower subscapular, axillary nerve, nerve to latissimus dorsi, and good. And radial nerve, radial nerve. So Vikram used to watch the first year Prarambh batch lectures, huh? Right? याद है मुझे. Vikram Karmarkar. Okay, your first year prof is approaching. Very good. So good preparation. Good. Fine. So these are the branches of the cords. Bachcho, these are the branches of the cords. And axillary artery के 3 parts होते हैं. हमने देखा था axillary artery is divided into 3 parts by pectoralis minor. Correct? Axillary artery is divided into 3 parts by pectoralis minor. So first and second part में क्या होता है? Cords. First and second part में cords होता है, and third part में branches होते हैं. Branches, right? All these branches of the cords, मतलब lateral cord, medial cord and posterior cord के जो branches होते हैं, this is present in the third part of the axillary artery. This is present in the third part. So first and second part में क्या होगा? Cords. Cords. And the cords are placed according to the names in the second part. So second part में समझ में आ रही है? हाँ. Hi ऋषभ. हाँ, I know ऋषभ. So अगर second part of axillary artery में draw करता हूँ, बच्चों देखो, I'm just drawing the second part of axillary artery. ठीक है? So this is the artery, axillary artery. This is the axillary vein. Axillary artery, axillary vein है. Second part है, second part of axillary artery है. So who's on the medial side? Medial side पे ये क्या cord होगा? Medial cord. पीछे क्या होगा? Posterior cord. And lateral पे क्या होगा? Lateral cord. Simple है. So the cords are placed according to the names with respect to the second part of axillary artery. Hi, I know all of you are there. Good. Revision हो रहा है ना बच्चों? Revision हो रहा है ना? Yes, Lakshya. Revision हो रहा है ना? You can correlate, you can recollect things. Yes. So now tell me the anterior relations. Anterior relation क्या होगा? एक तो ये मसल आ गया pectoralis major, दूसरा मसल आ गया pectoralis minor. हाँ? Second part में pectoralis minor पे आ गया ना बच्चों? So first anterior relations of the second part, pectoralis major, pectoralis minor. Hi Richa, I know बच्चा. Now posterior relations. Posterior relations में क्या होगा? This will be the subscapularis. Subscapularis. Posterior relation में आएगा subscapularis. Fine. So that's how you write. And third part में क्या आएगा? Third part में branches आएंगे. Branches of the brachial plexus. So ऐसे याद रखना है. This is how you will be able to revise this. Fine. And recollect. Okay. I've just told you the relations of the second part. Okay. Fine. So just tell me one thing. Branches from the roots of the brachial plexus. C5. Chalo, answer this now. Branch from C5 root. What is that? Branches from the roots of the brachial plexus. C5. Yes, yaha. Branch from C5. Anyone? Come on, students, come on. Hi, yaha. Branch from C5. What's that? Hello, yaha. Bolo. Anyone? C5 nerve to subclavius nahi hai, Veer. No. which is the nerve which arises from C5 root of the brachial plexus. That's a dorsal scapular nerve. Very good, very good. That's a dorsal scapular nerve or the nerve to rhomboids. Nerve to rhomboids. Dorsal scapular nerve or the nerve to rhomboids. Hi to all of you. From C5, C6, C7. बोल सकते हो C5, C6 and C7. ये कौन है? C5 nerve to subclavius नहीं है बच्चे. हाँ, C5, C6, C7 से कौन है? Nerve to serratus anterior. So what I'm telling you is, what is the branch from C5 root? That's a dorsal scapular nerve. C5, C6, C7 से क्या आता है? Nerve to serratus anterior. That's a long thoracic nerve. Long thoracic nerve. Hi Veer, क्या हुआ? Long thoracic nerve. There's one more nerve which arises from C5 root of the brachial plexus. बोल सकते हो? Yes, very good to all of you. There's one more nerve which arises from C5 root of the brachial plexus. बोल सकते हो? C5 से dorsal scapular nerve तो आ गया. That is nerve to rhomboids. C5, C6, C7 से nerve to serratus anterior. There's one more nerve which arises from C5 root of the brachial plexus, and this is an extra nerve supplying the diaphragm. चलो बच्चों बोलो. An extra nerve supplying the diaphragm. That's the accessory phrenic nerve. Yes, S.H. Chaudhary, very good. That's an accessory phrenic nerve. Accessory phrenic nerve. बच्चों phrenic nerve की root value पता है आपको? Very good. Phrenic nerve की root value क्या होता है? C3, C4, C5. C3, C4, C5 is the root value of phrenic nerve. Sometimes there's an extra phrenic nerve which arises from the C5 root of the brachial plexus, जिसका नाम है accessory phrenic nerve. Very good, very good. Now, upper trunk से दो nerves आते हैं. There are two nerves from the upper trunk. अब ये सबको पता है. And this point is the Erb's point. This is what Bikram was telling. This point is the Erb's point. Upper trunk से दो nerves आते हैं. One is the nerve to subclavius and दूसरा है suprascapular nerve. Hi Shippy. Hi Shippy. How are you? Okay. So one is the nerve to subclavius and दूसरा होता है suprascapular nerve. So upper trunk, two nerves, suprascapular nerve and the nerve to subclavius. Fine. So this point is the Erb's point. Okay. Sure. Good. That's fine. That's fine. Veer. Okay. Clear. So that's about the brachial plexus. इतना आप लिख सकते हो, and then relations of the brachial plexus you have to write. Okay. Now we'll start with this, the brachium, and then we'll see Erb's and Klumpke's paralysis. Fine. Okay. This is a revision lecture, बच्चों. चलो, we'll start with the front of the arm. Hi Shippy. How are you? Listening to the lecture? Good. Okay, so now you tell me that's our humerus. Okay, that's I'll start. Now tell me, there's a muscle which begins from the coracoid process, and goes to the humerus. What is this muscle? Coracoid process to the humerus. That's the coracobrachialis. Coracobrachialis. दोनों अच्छे book है हरी. Both books are very good. Now, there's one muscle जिसके दो heads है. There are two heads for this muscle. One head begins from the supraglenoid tubercle, passes through the bicipital groove. The second head begins from the coracoid process. Both these heads will join. I'm taking this out. इसको reflect here, and this will go and get inserted into the radial tuberosity. Radial tuberosity. ये कौन muscle है? Can anyone tell me what is the name of this muscle? Biceps brachii. Very good. That's a biceps brachii, right? So origin of biceps brachii, there are two heads of biceps brachii. That's fine, that's fine. There are two heads of biceps brachii. One is the long head, one is the short head. The long head arises from the supraglenoid tubercle of the scapula. The long head passes through the bicipital groove. I'll tell Shippy. It passes through the bicipital groove. The short head begins from the coracoid process of scapula. Both these heads joins to form the belly of the biceps, and insertion is on the radial tuberosity, right? Can anyone tell me what is the action of biceps brachii? Action of biceps. तो बच्चों इस तरीके से line diagrams draw करना है आपको. Simple diagrams you need to draw in the exams, but yes, you need to draw the diagrams. You need to make your answer sufficient size. Okay. Yes. What is the action of biceps brachii? चलो बोलो बच्चों. What is the main action of biceps? Long head is intracapsular. Yes. What is the main action of biceps? Main action. It's a, yes, it is a supinator. It's a strong supinator in a mid-flexed forearm. Not extended, not flexed. In a mid-flexed forearm, it's a powerful supinator. That is your first answer. It's the chief supinator in a mid-flexed forearm. Second, it's a flexor of the elbow joint. Third, it's a flexor of the shoulder joint. Very good. Very good. Flexion of the elbow joint, flexion of the shoulder joint. Fine. Okay. Coracobrachialis begins from the coracoid process, inserts on the humerus. Medial aspect of the middle half of the shaft of humerus. Medial aspect of the middle half of the shaft of the humerus. Yes, it flexes the elbow joint. It flexes the elbow joint. हाँ, elbow joint भी flex करेगा ना बच्चों. Zoe, my voice is proper. Zoe, थोड़ा सा volume बढ़ा लो अपना. My voice is this maximum voice I'm talking. Fine. Now let us understand the third muscle. Yes, what is this muscle? ये कौन है? This muscle begins from the humerus. It begins from the shaft of the humerus and it is inserted into the ulnar tuberosity. Inserted into the ulnar tuberosity. Anyone? What is this muscle? Now this muscle begins it begins from the middle half of the shaft of the humerus and this muscle gets inserted into the ulnar tuberosity. ये muscle है, this muscle is the brachialis. It's the brachialis. Fine बच्चों. So 3 muscles है front of the arm पे, simple है, बहुत ज़्यादा easy है. And this doesn't come in the theory. Short note आता है, biceps का short note आता है, brachialis का short note आता है. Fine. The main action of brachialis, it's a chief flexor of the elbow joint. Chief flexor of the elbow joint. Fine. Now, coming to the nerve. This nerve is very important. This nerve, yes, it comes as a short note, the musculocutaneous nerve. Musculocutaneous nerve. Third head of coracobrachialis is ligament of Schluter's. Very good. Okay. Now, the nerve is musculocutaneous nerve. The musculocutaneous nerve is a branch of lateral cord of the brachial plexus. The musculocutaneous nerve pierces this muscle. What is this muscle? The coracobrachialis. It lies on the brachialis and below the biceps. The musculocutaneous nerve pierces the coracobrachialis, lies between the biceps and the brachialis and continues as the lateral cutaneous nerve of forearm. It continues as the lateral cutaneous nerve of forearm. Fine, just remember this. So musculocutaneous nerve अगर short note आता है तो 1, it's a branch of lateral cord of the brachial plexus. Number 2, it pierces the coracobrachialis. Number 3, it lies between the biceps and the brachialis. And number 4, it continues as the lateral cutaneous nerve of forearm. Continues as the lateral cutaneous nerve forearm. It supplies the skin on the lateral aspect of the forearm from the elbow to the wrist joint. From the elbow to the wrist joint. Fine. So that's about the musculocutaneous nerve. That's about the front of the arm. Chalo bachcho, I'll just point out in this slide. You can identify these muscles. This is 1. This is 2. Identify this. This muscle is 3. And this is 4. Chalo, identify kar lo isme. And this is number 5. Brachialis, वीर, brachialis का insertion कहाँ पे? Brachialis begins from the humerus, half of the shaft of humerus. उसका insertion is on the ulnar tuberosity. अब बच्चे brachialis just crosses one joint, elbow joint को cross करता है. So what will it do? It does flexion at the elbow joint. बस एक action है, flexion at the elbow joint. Fine. Fine. चलो answer this बच्चों. Answer this. If you can answer this, no, then your concept becomes still better. Come on, students. What is number 1? What is number 2? What is number 3? I hope you can see this slide. What is number 4? 4 is a nerve and 5 is a nerve. 4 और 5 nerves है, बाकी सारे muscles हैं. Anyone? One is biceps. Yes, one is biceps. Very good. One is biceps brachii. Number 2 कौन है? Number 2. You can take this as number 2. Number 2 is a muscle. Number 2 is a muscle. Number 2 is a muscle. Mahi. 1 is biceps. Yes, Bikram. 1 is biceps. Number 2 कौन है? अरे बच्चे एक्सिलरी नर्व नहीं है, एक्सिलरी नर्व कैसे आएगा इधर? एक्सिलरी नर्व नहीं आता है वीर, फ्रंट ऑफ द आर्म में एक्सिलरी नर्व नहीं आती है. नो, एक्सिलरी नर्व इज अराउंड द नेक ऑफ द ह्यूमरस, इट वाइंड्स अराउंड द नेक ऑफ द ह्यूमरस. वी आर हियर, वी आर इन द फ्रंट ऑफ द आर्म. 3 coracobrachialis, very good. Number 3 is coracobrachialis. Number 3 is coracobrachialis. Number 1 is biceps brachii. Number 2 is brachialis. Number 4 is the musculocutaneous nerve, and number 5 is the lateral cutaneous nerve of forearm. रवि, बाद में बोलता हूँ, लेक्चर खत्म होने के बाद बोलता हूँ. हाँ, लेक्चर खत्म होने के बाद बोलता हूँ रवि. फाइन, क्लियर टू ऑल ऑफ यू? हाँ, वेरी गुड. एड्यूनेशन. Okay, clear? Yes, very good. So that's about the front of the arm. Front of the arm बस इतना ही है. Just biceps पे short note आता है, musculocutaneous nerve पे short note आता है. Fine. Okay, now let us go to the next thing. Erb's paralysis and Klumpke's paralysis short note आता है. If brachial plexus comes as an LAQ, you have to write about Erb's and Klumpke's paralysis. So Erb's paralysis causes undue separation of the neck from the shoulder, birth injuries, Erb's paralysis. Injury to the upper trunk of the brachial plexus. ठीक है, upper trunk में क्या होता है? C5C6, and this C5C6 is mainly present in 2 nerves. One is the axillary nerve and दूसरा होता है musculocutaneous nerve. बस ये 2 nerves याद रखना, axillary nerve and musculocutaneous nerve. Hi Mr. Mitra, क्या हुआ बच्चे? हाँ, युतिका, hi. So Erb's what is Erb's paralysis? Injury to the upper trunk of the brachial plexus. ठीक है, अब Erb's paralysis कैसे होता है? Erb's paralysis होता है when there's an accident. हाँ, accident हो गया, there's a separation of neck from the shoulder. ऐसे ऐसे, हाँ, यहाँ पे stretch हो गया, so upper trunk is injured. Second is birth injuries. ठीक है, so this is the reason causes of Erb's paralysis. Then upper trunk C5C6 होता है. C5C6 two nerves mainly contain C5C6. वैसे C5C6 तो बहुत सारे nerves में होता है. User, just wait, let me finish this, then we can talk. जिसको भी कुछ पूछना है ना, बाद में पूछना, हाँ, other than this upper limb, हाँ, let me finish the lecture, then we'll talk. Okay, बच्चों, come on. Axillary nerve. अब axillary nerve क्या supply करता है? Axillary nerve supplies the deltoid. Axillary nerve supplies teres minor. Deltoid and teres minor. अब बोलो, deltoid is paralyzed. ठीक है, deltoid is paralyzed. So क्या होगा? The arm is, हाँ, yes, deltoid is paralyzed. So deltoid is paralyzed, so arm is adducted. Teres minor does what? Lateral rotation. So lateral rotation is lost. So the arm is medially rotated. So because the axillary nerve is injured, deltoid paralyzed होता है. So deltoid का action क्या होता है? Abduction is lost, so the arm is adducted. Teres minor का action क्या है? Lateral rotation. So lateral rotation is lost, so the arm is medially rotated. So position of arm कैसे होगा? Arm is adducted, arm is medially rotated, plus there is Regimen batch sign. ये हो गए axillary nerve का involvement. Now we come to this musculocutaneous nerve. Okay. Now musculocutaneous nerve supplies what? Musculocutaneous nerve supplies biceps brachialis and coracobrachialis. Biceps brachii, coracobrachialis and brachialis. So biceps is paralyzed. Biceps paralyzed हो गया. What is the main action of biceps? The main action of biceps is supination. So supination is lost. So the forearm is pronated. Biceps गया. Biceps का main action, हाँ, yes, युतिका, yes, flattening of shoulder होगा ना. हाँ, so lecture will end at 9 o'clock. Okay, so biceps का action क्या है? Supination. So supination is lost, so the forearm is pronated. Fine. Brachialis is gone. So brachialis का action क्या था? Flexion at the elbow joint. So flexion is lost, so the forearm is extended. ठीक है? So the forearm is pronated, the forearm is extended, and there is loss of sensations on the lateral aspect of forearm. Loss of sensations on the lateral aspect of forearm. Gamer, this is for a revision lecture. This is for the exam going students. Exam going students के लिए lecture है ये. This is not for new students. Flexion is not possible. Yes. ठीक है बच्चों, तो कैसे याद रखोगे? Musculocutaneous nerve supplies biceps. Biceps का main action is supination. So supination गया, so the forearm is pronated. ठीक है. Number 2, brachialis. Brachialis का main action क्या है? Flexion. So brachialis paralyzed हो गया, तो forearm is extended. Plus there is a loss of sensations on the lateral aspect of forearm. समझ में आ गया? Erb's paralysis. So position of upper limb कैसे होता है? Arm is adducted, arm is medially rotated, the forearm is extended, the forearm is pronated, and then the fingers becomes like this. इसे हम बोलते हैं policeman stip hand. Policeman stip hand. Fine students. बाकी दो नर्व्स है, suprascapular nerve and the nerve to subclavius. वो सेम है. कुछ डाउट्स है इसमें तो बोलो. फाइन. Okay, we'll proceed. Fine. There is another there is sustained pronation. It depends on the muscle. It depends on थोड़ा pronation तो रहेगा ही. Sustained pronation है. Sustained. Yes, sustained pronation. That's how it is. ठीक है. Regeneration हुआ तो ठीक है. Fine. Now, what is this panel? What is this injury? A person is falling down, he holds a branch. बच्चों ये clinical questions आते हैं, clinical questions. A person is falling down from a tree. As he falls down, he holds a branch and he gets a jerk. जोर से jerk बैठता है. So which trunk of the brachial plexus is involved? The lower trunk of the brachial plexus. Lower trunk of the brachial plexus. Hi Pratham. ठीक है. Lower trunk of the brachial plexus is involved. Which roots are involved? C8 and T1. C8 and T1. And this C8 and T1 is mainly present in median and ulnar nerves. Median and ulnar nerves. And this C8 and T1, hello. Okay, this C8 and T1 is, okay, एक मिनट रुको. This C8 and T1 is mainly present in median and ulnar nerves. And this C8 and T1 supplies the intrinsic muscles of the hand. Intrinsic muscles. ये जो छोटे छोटे muscles हैं hand के, इसे supply करता है C8 and T1. Fine. So this small muscles are supplied by C8 and T1, the lumbricals, the intrasci. So this intrinsic muscles are paralyzed, so the person gets a claw hand. Claw hand हो जाता है. Because all the small muscles are paralyzed, so the person gets a claw hand. Is the voice okay now? थोड़ा सा मैंने माइक ऊपर ले लिया. Is the voice okay now? ठीक है? Okay. So this is Klumpke's paralysis, injury to the lower trunk of the brachial plexus. The nerve roots involved is C8 and T1. C8 and T1 is mainly present in the median and ulnar nerves, जो छोटे छोटे muscles को supply करते हैं. And paralysis of this muscle results in a claw hand. थिनार भी आएगा ना? थिनार भी आएगा बच्चे. थिनार भी आएगा. Yes, complete claw hand. Head and neck third या fourth lecture होगा. Third or fourth. चिराग. ठीक है? Clear to all of you? Plus there is paralysis of the ulnar flexus of the forearm and the wrist. Ulnar flexus of forearm and wrist कौन है? Flexor carpi ulnaris and the flexor digitorum profundus. Ulnaris and profundus is paralyzed. So this is claw hand. Third या fourth lecture होगा चिराग. Fine. Fine है बच्चों. Clear? Now फटाफट cubital fossa बोलिए. Cubital fossa. Okay, look at this. Look at this. I'll quickly draw the slide. This is a very easy slide to understand. That's a first rib. ये है अपना subclavian artery. ये subclavian artery का अब बना axillary artery. ये बन गया axillary artery. This axillary artery is divided into three parts by the pectoralis minor muscle. ये है अपना teres major muscle. and this at artery अब बन गई brachial artery, ये बन गई brachial artery. Fine. Now you tell me, what is this cord of the brachial plexus, second part of axillary artery में? What is this cord? What is this cord? That's a lateral cord. That's a medial cord. What is this nerve? ये कौन सी nerve है? That's a lateral root of median nerve. That's a medial root of median nerve. And ये बन गया median nerve. Median nerve. बच्चों LAQ आता है nerves पे, median nerve, ulnar nerve, सब पे LAQs आता है. So you have to be very clear. How's the median nerve formed? The median nerve is formed by the lateral root of median nerve, which is a branch of lateral cord, and the medial root of median nerve, which is a branch of medial cord. Now, the medial root of median nerve is longer. It crosses the axillary artery, joins with the lateral root. अब बन गया median nerve. So, जब median nerve बनता है, when the median nerve is formed, it is formed lateral to the third part of axillary artery. Okay, so this all you have to include in the median nerve. So when the median nerve is formed, it is on the lateral aspect of the third part of the axillary artery. Now this median nerve is going to cross the brachial artery. The median nerve crosses the brachial artery from the lateral to the medial side. Lateral to the medial side. अब यहाँ पे we come here. What is this now? This is the cubital fossa. यह है cubital fossa. So cubital fossa के boundaries क्या है? Medially is the pronator teres. Laterally is the brachioradialis. The base is formed by the imaginary line joining the two epicondyles. The base is formed by the imaginary line joining the two epicondyles. Apex is formed where the two muscles meet. The floor of the cubital fossa is formed by. चलो बोलो बच्चों. So medially pronator teres, laterally brachioradialis, base is the imaginary line. Floor of the cubital fossa is formed by. Floor of the cubital fossa. अक्षत. MBBR is fine. वो contents है बच्चे, वो contents है. MBBR is contents. Floor बताओ. Floor of cubital fossa. थोड़ा और डिटेल में ना बच्चे, यही है देखो ना, क्यूबाइटल फोसा यही है बच्चे. वन इज सुपाइनेटर हिडन इंडिया. वन इज सुपाइनेटर, दूसरा कौन है? हु एल्स फॉर्म्स द फ्लोर ऑफ क्यूबाइटल फोसा? एक सुपाइनेटर है, दूसरा ब्रेकियालिस. ब्रेकियालिस एंड सुपाइनेटर. ब्रेकियालिस एंड सुपाइनेटर, दिस आर द टू मसल्स व्हिच फॉर्म्स द फ्लोर ऑफ क्यूबाइटल फोसा. सो क्यूबाइटल फोसा इज वेरी इंपॉर्टेंट. शॉर्ट नोट भी आता है, LAQ भी आता है बच्चों. If it comes as a short note, just write in short. Short में लिखना, थोड़ा सा एक diagram बनाओ. If it comes as an LAQ, write it in the form of an LAQ. Then you have to explain. ठीक है, you have to understand what you're writing. SAQ है, LAQ है, देख के आंसर करो. Fine. Okay. Now contents of cubital fossa. Contents of cubital fossa में number 1 is the, what is this? Median nerve. Second is the brachial artery. This brachial artery divides into two radial and ulnar arteries. It divides into a radial and ulnar artery. तीसरा क्या आएगा? That's the head of the radius. That's the neck of the radius. That's a radial tuberosity. And ये क्या muscle होगा? What is this muscle inserted on the radial tuberosity? That's the biceps brachii. Biceps brachii. And the last one is this nerve. What is this nerve? The radial nerve. Radial nerve. Or the superficial branch of radial nerve. वीर, cephalic nerve नहीं होती है. Cephalic nerve नहीं होती है. So contents of the cubital fossa. Contents of the cubital fossa from medial to lateral. The median nerve, the brachial artery with radial and ulnar arteries, the tendon of biceps, and the radial nerve. Radial nerve. ठीक है, cubital fossa clear है? Hidden India, fine. हाँ, okay. उसका इंपॉर्टेंस क्या है? व्हाट इज द इंपॉर्टेंस ऑफ क्यूबाइटल फोसा? सो median cubital vein होती है. You can remove blood from there. You can give IV injections in the median cubital vein. Blood pressure is recorded in the cubital fossa. Fine, that's it. ठीक है बच्चों? Okay, that completes the arm. इतना arm है. Median nerve clear है? How does the median nerve? So median nerve जब LAQ आता है, कैसे लिखोगे median nerve? Medial nerve is formed by two roots. One is the lateral root of medial nerve, which is a branch of lateral cord. The medial root of medial nerve, which is a branch of medial cord. The medial root is longer, cross करती है axillary artery को, joins with the lateral root, forms a median nerve. So median nerve is on the lateral aspect of the third part of axillary artery. ये है ना tendon of biceps, ये है बच्चे tendon of biceps. Now this median nerve will cross the brachial artery from the lateral to the medial side. The median nerve is now in the cubital fossa. How does the median nerve leave the cubital fossa? The median nerve leaves the cubital fossa by passing between the two heads of pronator teres. ये pronator teres के दो heads से निकलती है median nerve, and this median nerve gets compressed between the two heads of pronator teres. इसे हम बोलते हैं pronator teres syndrome. What is pronator teres syndrome? It's the compression of medial nerve between the two heads of pronator teres. Fine, that's pronator teres syndrome. याद रखना. Carpal tunnel syndrome is the compression of medial nerve in the carpal tunnel. Pronator teres syndrome is the compression of medial nerve between the two heads of pronator teres. याद रखना. Okay, fine. So now coming to the forearm. अब forearm is not important as far as LAQ is concerned, but फिर भी muscles of the forearm, you can quickly answer this. Muscles of the forearm, ये mainly practicals के लिए important है. हाँ, तो practicals का एक revision होगा, revision lecture for practicals होगा, but you can just tell me this is number 1, 2, 3, 4 and 5. चलो start. What are these muscles? Superficial muscles. Superficial muscles in the front of the forearm. Answer this. कार्पल टनल सिंड्रोम में ब्रिज ड्रॉप नहीं होता है बच्चे. कार्पल टनल सिंड्रोम में ब्रिज ड्रॉप क्यों होगा? बाउंड्रीज ऑफ क्यूबिटल फोसा बोला ना बच्चे मैंने. हाँ, होप आई हैव टोल्ड यू. नो, medial is pronator teres, lateral is brachioradialis, the base is the imaginary line joining the two epicondyles. हाँ, चलो बोलो बच्चों. आंसर दिस इज द फ्रंट ऑफ द फोरआर्म. मसल्स बताओ. मसल्स नंबर 1 pronator teres. Number 1 is the pronator teres. Number 2, this is important from practical point of view. ये theory में नहीं पूछता है, so I'm just going. Radial nerve injury में wrist drop होगा. Yes. Medial nerve injury में wrist drop नहीं होता है. Radial nerve injury में wrist drop होता है. Number 2 is flexor carpi radialis. Yes. Number 1 is pronator teres. Number 2 is flexor carpi radialis. Number 3 is palmaris longus. 4th is flexor digitorum superficialis, and 5 is flexor carpi ulnaris. Flexor carpi ulnaris. Okay, that's fine. Okay, so number 1 is pronator teres. Number 2 is flexor carpi radialis. Number 3 is palmaris longus. Number 4 है flexor digitorum superficialis, and 5 is flexor carpi ulnaris. Fine. These are the superficial muscles. Now, can anyone tell me what is this muscle? Number 1. What is this number 1 and what is this number 2? ये किसका टेंडन है? Look, ये number 2 है ना, it divides into 2. ये ऐसे दो में split होता है. What is this? And what is number 1? Can anyone tell me this? Yes. ये सब practicals के लिए है. Practicals का separate lecture होगा. 1 lecture for practicals होगा, revision practicals. Any guesses? Yes, बच्चे आजाद. Everyone can see. सबके लिए anatomy होता ही है. Right. Number 1 कौन है? Shipra. Yes. Number 2 is flexor digitorum superficialis. Number 2 is flexor digitorum superficialis. Number 1 is flexor digitorum profundus. हाँ, flexor digitorum superficialis and profundus है. Okay, so number 2 is flexor digitorum superficialis because flexor digitorum superficialis divides into 2. ऐसे दो में divide होता है and it is inserted into the middle phalanx. ये middle phalanx में inserted है. Okay. Fine. So flexor digitorum superficialis is inserted on the base of the middle phalanx, and flexor digitorum profundus is inserted into the base of distal phalanx. Base of distal phalanx. ठीक है? सो दो सुपरफिशियलिस है बच्चे. हाँ विक्रम, नंबर 2 इज फ्लेक्सर डिजिटम सुपरफिशियलिस, वेरी गुड. एंड नंबर 1 इज फ्लेक्सर डिजिटम प्रोफंडस. याद रखना फ्लेक्सर डिजिटम प्रोफंडस का इंसर्शन इज इनटू द बेस ऑफ डिस्टल फैलिंग्स. अगर क्लिनिकल क्वेश्चन आता है जिसमें डिस्टल फैलिंग्स कैन नॉट बी फ्लेक्स्ड, you should know it is injury to profundus, right? Okay, chalo, that's fine. Okay, now I'll just come to this. We'll come to flexor retinaculum and the carpal tunnel. Flexor retinaculum and carpal tunnel, fine. I'll just draw a slide. एक slide draw करता हूँ. चलो, have a look at this. So this are the carpal bones. Carpal tunnel syndrome बहुत ज़्यादा important है. हाँ, this comes as a short note also. So यह है flexor retinaculum. Flexor retinaculum यहाँ पे split हो जाता है. फारूक, ठीक है. Okay. So this is a section, right? ठीक है. These are the carpal bones. This is the flexor retinaculum. The flexor retinaculum splits into two. Now tell me, what is this tendon? ये कौन सा tendon है which passes from here? What are these four tendons of? What are these four tendons of? What is this tendon? There's a nerve here. What is this nerve? That's a median nerve. Median nerve. Okay. These are the four tendons of flexor digitorum superficialis and flexor digitorum profundus with ulnar bursa. Ulnar bursa. This is flexor pollicis longus with radial bursa. Flexor pollicis longus with radial bursa. ठीक है. What is this one? ये कौन है? Can anyone tell me what is that? So this is the flexor digitorum superficialis and profundus with ulnar bursa. This is the flexor pollicis longus with radial bursa. That's a median nerve. ये कौन है? ये. हाँ, very good. अक्षत राय. What is this? ये किसका टेंडन है? Anyone? This was flexor carpi radialis. That's flexor carpi radialis, right? Now, what passes above the flexor retinaculum? Flexor retinaculum के ऊपर से कौन जाता है? What is this? This is palmaris longus. Palmaris longus. On the medial side, एक extension होता है ऐसे. What is this known as? Volar carpal ligament. Volar carpal ligament. And this tunnel is known as Guyon's tunnel. Volar carpal ligament and Guyon's tunnel यहाँ से जाता है ulnar artery and ulnar nerve. This is ulnar artery and ulnar nerve. एक artery होती है यहाँ पे. There's an artery here. This is the superficial palmar branch of radial artery. Superficial palmar branch of radial artery. Fine. And दो nerves होते हैं. There are two nerves here. This is the palmar cutaneous branch of ulnar nerve, and this is the palmar cutaneous branch of median nerve. Palmar cutaneous branch of ulnar nerve and palmar cutaneous branch of median nerve. Okay, very good. Fine. So ये diagram is very important. ये diagram आता है, draw a diagram of carpal tunnel या फिर carpal tunnel syndrome भी आता है. So when there's an ulnar bursitis, this median nerve gets compressed. Okay, so the median nerve is compressed between, median nerve is compressed between the ulnar bursa and the flexor retinaculum. So that is known as carpal tunnel syndrome. Carpal tunnel syndrome. Fine. So ये याद रखना, diagram याद रखना. This comes in the MCQs. Carpal tunnel syndrome. Ansh, carpal tunnel syndrome is the Ansh Savaria, Ansh Sarvia, sorry. You're there. So what is carpal tunnel syndrome? It's a compression of median nerve between the ulnar bursa and the flexor retinaculum, that is known as carpal tunnel syndrome. Carpal tunnel syndrome में क्या होगा? Whatever median nerve supplies in the hand is all paralyzed, सब paralyzed होता है. Very good. During pregnancy या फिर a person is operating computer for a very long time, so that person develops carpal tunnel syndrome. ठीक है बच्चों, come on. हाँ, ये clear है? ये याद रखना, carpal tunnel. Now I'll just tell you about the lumbricals. एक lumbricals बोल देता हूँ, that is very important. carpal tunnel के boundaries, फहद, carpal tunnel के boundaries क्या देखो ना, नीचे these are the carpal bones and that's a flexor retinaculum. बस वही है, carpal bones and flexor retinaculum. वो है ना, बाकी YouTube पे lectures है मेरे on all this, वो आप देख सकते हो. हाँ, fine. Okay, yes, take hands, very good. चलो, I'll just tell you about the lumbricals. हाँ, lumbricals के बारे में देखते हैं. Can anyone tell me this? Lumbricals, I'll just tell you in short. Lumbricals देखते हैं fast, and then comes the introssia. Lumbrical short note आता है, introssia short note आता है. You can tell me ये किसके tendons है? What are these tendons of? What are these tendons of? Anyone? हाँ, ये किसके tendons है? So the lumbricals arise from, बोलता हूँ ये खत्म होने दो. Lecture is still 9 only. 9 बजे तक ही lecture है, तो okay, whatever maximum I can finish, I'm trying to finish. चलो बोलो, what are this? ये कौन से tendons है बच्चों? We are talking about lumbricals. So lumbricals छोटे छोटे worm-like muscles होते हैं, which arise from the tendons of. Come on, the question is open to all of you. Lumbricals arise from the tendons of flexor digitorum profundus. ये है flexor digitorum profundus के tendons. Now, the first lumbrical arises from the lateral aspect of the first tendon of profundus. The second lumbrical arises from the lateral aspect of the second tendon of profundus. Flexor digitorum profundus से arise होता है. The third lumbrical arises from the medial aspect of the second and the lateral aspect of the third. And the fourth lumbrical arises like this. Flexor digitorum superficial से arise नहीं होता है lumbrical. Hope it arises from flexor digitorum profundus. Tendons of flexor digitorum profundus से arise होता है lumbricals. The first lumbrical is arising from the lateral aspect of the profundus tendon. The second lumbrical arises from the lateral aspect of second tendon of profundus. These two muscles are unipinnate. ये होता है unipinnate muscle. The third and the fourth lumbrical arises from two tendons. So ये होते हैं bipinnate. These are bipinnate muscles, right? So these are bipinnate muscles. Clear है? So unipinnate and bipinnate is fine. Where is the insertion of lumbricals? These lumbricals are inserted on the lateral aspect of the base of the proximal phalanx. So ये है phalanges, ये है proximal phalanx. तो इसका lateral aspect. All the lumbricals are inserted on the lateral aspect of the base of the proximal phalanx of the fingers. And यहाँ से it goes and gets inserted into the base of distal phalanx. पीछे से जाता है. Okay. So what is the main insertion of lumbricals? On the lateral aspect of the base of the proximal phalanx. Lumbricals will go like this, ऐसे, and ऐसे. So पहला insertion is on the lateral aspect of the base of proximal phalanx, and यहाँ से it goes on the dorsal aspect and gets inserted into the base of distal phalanx. Okay, inserted into the base of distal phalanx. Now, when this part contracts, what does it do? It does flexion at metacarpophalangeal joints. Okay, ये first part जब contract करता है, it causes flexion at the metacarpophalangeal joints, and when this part contracts, it causes extension at interphalangeal joints, right? So when this part contracts, flexion at metacarpophalangeal joints, and जब ये part contract होता है, it causes extension at interphalangeal joints. Fine. What is the nerve supply? The first and the second are supplied by median nerve. First and second को कौन supply करता है? Median nerve. The third and the fourth is supplied by ulnar nerve. First and second median nerve, third and fourth is supplied by ulnar nerve. Dorsal digital expansion is fine. Lateral aspect पे insert होता है. Fine. अगर lumbrical paralyzed होते हैं, if the lumbricals are paralyzed, normally what do they do? Flexion at metacarpophalangeal joints and extension at interphalangeal joints. ये normal action है. When the lumbricals are paralyzed, exactly opposite occurs, and this is what we call as claw hand. Opposite action होता है. So there is extension at metacarpophalangeal joints and there is flexion at the interphalangeal joints, and this is what we call as a claw hand. Yes, ये होता है Klumpke's paralysis में. Klumpke's paralysis में claw hand होता है. ठीक है बच्चों? Clear to all of you? पामर है बच्चे. फहद रिवाइज करना पड़ेगा. फहद, दिस इज अ क्विक गो थ्रू. ये मैं क्विक गो थ्रू कर रहा हूँ. दिस इज अ रिवीजन लेक्चर. हाँ, ये रिवीजन लेक्चर है. हाँ, अगर आपको डिटेल में देखना है ना तो यू कैन सी द रेगुलर लेक्चर्स. हाँ, रेगुलर लेक्चर्स देख लो. ठीक है बच्चों, क्लियर? So now just tell me, what are the muscles supplied by median nerve in the hand? चलो start. Muscle supplied by median nerve in the hand. Very important. MCQs में भी आता है ये. Muscle supplied by median nerve in the hand. Number one, the three muscles of thenar eminence and the first two lumbricals. Three muscles of thenar eminence, which are they? ये कौन से? Abductor pollicis brevis, flexor pollicis brevis, opponens pollicis. Abductor pollicis brevis, flexor pollicis brevis, opponens pollicis, and first and second lumbricals. So total 5 muscles supplied by the median nerve in the hand. 5 muscles supplied by median nerve in the hand. ठीक है? Flexor pollicis brevis half supply करता है. Half. Can anyone tell me which half? Which half of flexor pollicis brevis is supplied by the median nerve? Babu Singh, very good, Babu Singh, bolo. First and second lumbrical and superficial head of flexor pollicis brevis. Very good. Superficial head of flexor pollicis brevis is supplied by median nerve. Okay. Clear? So muscle supplied by median nerve in the hand. Number one, abductor pollicis brevis. Second is the superficial head of flexor pollicis brevis. Number three is the opponens pollicis. Number four is the first and the second lumbrical. I hope you can recollect this. Muscle supplied by ulnar nerve in the hand. Muscle supplied by the ulnar nerve in the hand. हाँ ठीक है वीर. ओके. वो डिटेल्स में कोई पूछता नहीं है वैसे. डिटेल्स में कोई नहीं पूछता वो. ठीक है. Now muscle supplied by ulnar nerve in the hand. Anyone? Ulnar nerve in the hand. Number one is abductor digiti minimi brevis, flexor digiti minimi brevis, opponens digiti minimi. These are the three muscles of hypothenar eminence. ठीक है. Finals are over. Very good. शिव, कैसे थे एग्जाम्स? Good. Okay. So, what is the ulnar nerve supply in the hand? The three muscles of hypothenar eminence. Number one is the abductor digiti minimi brevis, flexor digiti minimi brevis, opponens digiti minimi. Fine. Then third and fourth lumbricals. फिर आता है four-palmar introsci. Then comes four dorsal introsci. Then comes adductor pollicis. And the deep head of flexor pollicis brevis. The deep head of flexor pollicis brevis. Okay, great. Good, all the best. Okay, out of all this, one muscle is known as the graveyard of ulnar nerve. बच्चों ये MCQ आता है. This comes as an MCQ. Out of all these muscles, जो ulnar nerve supply करती है, ulnar nerve goes and ends in a muscle. Ulnar nerve goes and ends in a muscle. Which muscle is that? भुवनेश, first lecture है ये. First lecture है. फरे के series के lecture है ये. Anyone? ulnar nerve goes and ends. हाँ पामर इज वो मैं बोलता हूँ श्रेयस आई वाज टेलिंग यू जस्ट वेट मैं बोल रहा था जस्ट वेट आउट ऑफ ऑल दिस मसल्स ulnar nerve goes and ends in a muscle. What is that muscle? That muscle is known as the graveyard of ulnar nerve. Very good, you got this. Graveyard of ulnar nerve is adductor pollicis. Adductor pollicis को बोलते हैं graveyard of ulnar nerve. Very good बच्चों. अब ये जितने भी muscles हैं ना, this is supplied by the deep branch of ulnar nerve. So ये ulnar nerve है, इसका deep branch है, deep branch. So deep branch of ulnar nerve supplies this muscles. And there is one superficial branch of ulnar nerve. Superficial branch of ulnar nerve supplies one muscle. And this superficial branch of ulnar nerve is sensory, cutaneous nerve. Cutaneous होता है. What muscle does it supply? It supplies the palmaris brevis. Palmaris brevis. So बच्चों याद रखना palmaris brevis is supplied by the superficial branch of ulnar nerve. Right, and the deep branch of ulnar nerve supplies this 15 muscles. बहुत important है. Clear to all of you? Okay. कुछ doubts है तो बोलो. If the ulnar nerve is injured, all these muscles are paralyzed. You get a claw hand of this 2 digits. Partial claw hand. अगर median nerve injury होता है, Akshat, some books say first palmar interosseous is absent. Some books say first palmar interosseous is absent. उसको adductor pollicis है. Fine. अगर median of injury होती है तो the first 2 fingers का claw hand होता है. So इसे हम बोलते हैं partial claw hand. And if both of them are gone, you get a complete claw hand. Complete claw hand. Fine. Okay, clear. So ये याद रखना muscle supplied by median nerve and ulnar nerve in the hand. ये याद रखना. You get LQs on all this. हाँ, LQs सब आते हैं. Flexor retinaculum ये अभी देखा हमने. We've seen this. Lumbricals are clear to all of you. So these are the lumbricals. First lumbrical, second lumbrical, third and fourth lumbricals. Okay. So first, second, third and fourth lumbricals. Hi Sugesh, very good. Very good, very good. Chalo, now we'll go to this. Median nerve in the hand is clear. What is this test? ये बोल सकते हो, what is this test? ब्रेकियल प्लेक्सस आना चाहिए बच्चे. बाबू सिंह, ब्रेकियल प्लेक्सस हमेशा लगेगा. आगे चल के हमेशा ब्रेकियल प्लेक्सस लगेगा. You have to know this. What is this test? मैं पेन रखता हूँ ऐसे. I keep my hand like this and I take the pen, I touch the pen like this. So what is this known as? This is known as pen test. Pen test. And ये कौन से मसल के लिए है? This is for the abductor pollicis brevis. Abductor pollicis brevis के लिए है. Median nerve को टेस्ट कर रहे हैं अपन abductor pollicis brevis. This is pen test. Yes. What is this test? What is this test? This is known as card test. Card test. Medical life. Just wait. Good. बाद में देखते हैं कौन कहाँ से. This is known as card test. Card test is for palmar interosseous. ऐसे ऐसे palmar interosseous contract करते हैं. So you can hold the card. इसे बोलते हैं card test. ठीक है. This is for palmar interosseous. What is this? This is book test. Book test. Book test. This is for adductor pollicis. या adductor pollicis के लिए. Okay. So book test is for adductor pollicis. Adduction करते हैं thumb का to hold the book. So this is adductor pollicis. Fine. Clear है बच्चों? Okay. Great. Very good. Okay. Sugesh. कैसा है ना, फरे इज अ रिवीजन लेक्चर, मतलब इट्स जस्ट अ क्विक गो थ्रू द एंटायर सिलेबस। वैसे 2 घंटे में अपर लिम्ब खत्म करना फाइन। ओके, नाउ वी कम टू दिस। चलो बच्चों, एक लास्ट पार्ट है, फटाफट आंसर करो ये। दिस इज अ स्कैपुला, दैट्स अ ह्यूमरस। नाउ यू टेल मी, ये कौन सा मसल है? अ मसल व्हिच बिगिंस फ्रॉम द इंफ्राग्लिनोइड ट्यूबरकल ऑफ स्कैपुला। ये कौन सा मसल है? प्रैक्टिकल्स के लिए एक सेपरेट लेक्चर लेंगे। हाँ, चलो बच्चों बोलो, अ मसल व्हिच बिगिंस फ्रॉम द इंफ्राग्लिनोइड ट्यूबरकल ऑफ स्कैपुला। अ मसल व्हिच बिगिंस फ्रॉम, ये है अपना बाइसेपिटल ग्रूव, फ्रॉम द शाफ्ट बिलो द बाइसेपिटल ग्रूव, एंड एक मसल होता है व्हिच बिगिंस फ्रॉम अबाउट द बाइसेपिटल ग्रूव। ये कौन है? हाँ, आंसर दिस। व्हाट इज दिस नंबर 1? हाँ, I'll label this as number 1, I'll label this as number 2, and this as number 3. Huh, very good, very good. This is the long head of triceps. Number 1 is the long head of triceps, begins from the infraglenoid tubercle. Number 2 is the medial head of triceps, medial head, जो ह्यूमरस से अराइज होता है, स्पाइरल ग्रूव के नीचे से अराइज होता है। एंड नंबर 3 इज द लैटरल हेड ऑफ ट्राइसेप्स, लैटरल हेड ऑफ ट्राइसेप्स। ठीक है, fine. Where is the insertion of triceps? The triceps is inserted on the olecranon process. Olecranon process पे इसका insertion है, triceps का inserted on olecranon process of ulna. Lag हो रहा है, ठीक है। So it is inserted on the olecranon process of ulna. What is the main action of triceps? The main action of triceps is extension at the elbow joint. Extension at the elbow joint, that's the main action of triceps. The long head of triceps also does extension at the shoulder joint. The long head also does extension at the shoulder joint. Fine. Long head of triceps does extension at the shoulder joint. Fine. Abhi na, I'll just start with this. I'll just give a brief outline about this. Just try to understand this. ये समझ लो, ये है अपना स्पाइरल ग्रूव. So which is the nerve of the back of the arm? पीछे कौन है? Radial nerve. पीछे कौन है? Radial nerve. What is the root value of radial nerve? Radial nerve बहुत important है. Radial nerve is very important. Nerve सारे important है. Nerve सारे करके जाइए. Very good अक्षत. Yes बच्चों, you can watch the lectures. Yes. So radial nerve is a continuation of the posterior cord of the brachial plexus. Radial nerve का root value है C5 to T1. C5 to T1. Radial nerve is first in the axilla. ठीक है, ये है अपना radial nerve axilla में. From the axilla it goes in the spiral groove. So one is axilla. ये axilla हो गया. Number 2 is the spiral groove. Spiral groove में गया. Then the radial nerve comes on the lateral aspect of the arm. ये है number 3. Lateral aspect of the arm, and number 4 is cubital fossa. Number 4 is cubital fossa. Radial nerve is very important बच्चों, ठीक है। So radial nerve पहले axilla में होती है. From the axilla ये पीछे गया, spiral groove के अंदर गया. Yes. हाँ, from the lower triangular space, and then it goes on the lateral aspect of the arm. अनिल, थोड़ा सा डिटेल में चाहिए. फरे इज अ रिवीजन. एंड देन इट एंटर्स द क्यूबाइटल फोसा. फिर ये क्यूबाइटल फोसा में जाता है. ये सात्विक, व्हाट हैपेंड? सात्विक, जस्ट वेट, विल डिस्कस वंस द लेक्चर गेट्स ओवर. ठीक है. सो नाउ यू टेल मी व्हाट आर द ब्रांचेस ऑफ रेडियल नर्व इन द एक्सिला. चलो स्टार्ट बच्चों. रेडियल नर्व इन द एक्सिला. Radial nerve in the axilla gives 2 muscular and 1 cutaneous branch. बस ऐसे याद रखना. Radial nerve in the axilla gives 2 muscular, 1 cutaneous branch. 2 muscular branch to the long head of triceps and the medial head of triceps. Long and the medial head of triceps. 1 cutaneous branch, इसका नाम है posterior cutaneous nerve of arm. Posterior cutaneous nerve of arm. बस ये टेबल याद रखना. एक्सिला में 2 मस्कुलर, 1 क्यूटेनियस ब्रांच देता है. हाँ, यस दिव्या, फाइन, ओके. Satvik has got some shock. Listen to the lecture. बाद में discuss करते हैं what happened to you. So 2 muscular, 1 cutaneous branch. Number 2, we come to the spiral groove. Spiral groove में the radial nerve gives, again, it gives 3 muscular and 2 cutaneous branches. 3 muscular, 2 cutaneous branch. Yes? Fine. 3 muscular and 2 cutaneous branch. 3 muscular branches are given to, yes, lateral head of triceps, medial head of triceps, and anconeus. Lateral head, medial head, and anconeus. Fine. Lateral head of triceps, medial head of triceps, and anconeus. Fine. Okay. Now, 2 cutaneous branches. Just remove him out. Just throw him out of the class. Remove that Satvik out of the class. Okay. Now, coming to the 2 cutaneous branches. 2 cutaneous branches are, yes, one, बोल सकते हो, one is the posterior cutaneous nerve of forearm, posterior cutaneous nerve of forearm, and the lower lateral cutaneous nerve of arm. Lower lateral cutaneous nerve arm. ठीक है? Fine. So, in the spiral groove, it gives 3 muscular and 2 cutaneous branches. Hi Ayush. Okay. बोलता हूँ अनिल, I'll tell you. सब है slides में, मैं बोलता हूँ क्या LAQs क्या SAQs prepare करना. I'll tell you everything. Just wait. Hold on for some time. हाँ, बोलता हूँ, neat cracker. So, in the spiral groove, it gives 3 muscular, 2 cutaneous branches. Muscular branches to lateral head, medial head, and anconeus, and cutaneous branch is the posterior cutaneous nerve of forearm and the lower lateral cutaneous nerve of the arm. ये पूछ रहा था ना कोई? Someone was asking this. Fine. And now, where do we go? In the on the lateral aspect of the arm. Number 3 is lateral aspect of the arm. What does it supply? It supplies the brachialis, the brachioradialis, and the extensor carpi radialis longus. And number 4, in the cubital fossa, it divides into 2 branches. एक है superficial branch and एक है deep branch. Deep branch का नाम है posterior introitious nerve. Posterior introitious nerve. So lateral aspect of the arm में, what is the radial nerve supply? It supplies, yes, it supplies the brachialis, it supplies the brachioradialis, and it supplies the extensor carpi radialis longus. Okay, extensor carpi radialis longus. Fine. And in the cubital fossa, it divides into a superficial and deep branch. अब जो deep branch होगा, it supplies all the muscles on the back of the forearm. Okay, it supplies all the muscles on the back of the forearm. Fine. Bhuvnesh, this is a revision lecture, Bhuvnesh. Okay, this is not for the beginners. ये revision lectures है. Clear है? Fine, bachcho. The superficial branch is sensory. It lies in the roof of the snuff box. It lies in the roof of the snuff box. Okay, the superficial branch. Any doubts you have, you let me know. I'll just tell the team to remove this person. Just give me 2 minutes. Fine. Wait, I've told the team. Anatomical snuff box बोलता हूँ. Just 2 minutes. Just don't pay attention to this person. ये बंदे को निकाल दो जरा. हाँ 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 हाँ. ठीक है ठीक है ठीक है. Okay. Now we'll come to the anatomical snuff box. Now understand this anatomical snuff box. ये है radius. That's a radial tuberosity. That's a shaft of the radius. That's a styloid process. That's a ulna. That's a styloid process of ulna. Okay. Now how do you understand the anatomical snuff box? कैसे याद रखोगे? देखो, that's the back of the forearm. Back of the forearm एक muscle है which begins from both radius and ulna. What is this? Abductor pollicis longus. There's a muscle which begins from both radius and ulna. That's the abductor pollicis longus. There's a muscle which begins from the radius alone. That's the extensor pollicis brevis. Extensor pollicis brevis. Okay. this foolish person has come. All of you don't pay attention to him. Just concentrate on the lectures. ऐसे लोग आते ही रहते हैं. So abductor pollicis longus and extension pollicis brevis. Now ये जो abductor pollicis longus and extensor pollicis brevis है ना, ये साथ में जाते हैं. They go together. They form the lateral boundary of the snuff box. They form the lateral boundary of the snuff box. Okay. What is this? This is the extensor pollicis longus and ये बनाएगा medial boundary. ये बन गया अपना snuff box. ये बन गया अपना snuff box. ठीक है ना? You should be used to all these disturbances, बच्चों. You should be used to all these disturbances. ठीक है? People, they don't have any other work. Hi, good evening. ठीक है? So कैसे याद रखोगे इसको? Lateral boundary of the snuff box is formed by the abductor pollicis longus and the extensor pollicis brevis. हाँ, बस ये slide याद रखना. ये slide याद रखना. हाँ, उसको block कर रहे. The team is going to block him. Okay. Extensor pollicis longus forms the medial boundary. हाँ, इसको ऐसे याद रखना. हाँ, आयुष, just wait, आयुष. बोलता हूँ. Just wait. First year, before the first year starts, first year start hoga na, just wait. What is the floor of the snuff box formed by? The floor of the snuff box is formed by two muscles. Two muscles form the floor, ECRL and ECRB. ECRL and ECRB. Okay. So, the lateral boundary of the snuff box, दो muscles बनाता है, abductor pollicis longus, extensor pollicis brevis. The medial boundary is formed by the extensor pollicis longus. The floor is formed by the styloid process. ये styloid process है. दो bones होते हैं, scaphoid and trapezium. Styloid process, scaphoid and trapezium, and two muscles, ECRL and ECRB. ये दोनों muscles floor में होंगी. ठीक है? Floor is formed by the styloid process, scaphoid and trapezium, and the two muscles are going to form the floor. ECRL, ECRB. Contents क्या होगा? Contents is the radial artery. Contents में क्या है? Radial artery, and roof is formed by cephalic vein and the superficial branch of radial nerve. Cephalic vein and the superficial branch of radial nerve. Look at this. So roof में कौन है? Superficial branch of radial nerve है and the cephalic vein. Fine. What is the importance of anatomical snuff box? It was used in the earlier days. वो sniffing के लिए use करते थे. हाँ, sniffing. That's it. That's about the snuff box. ठीक है. Then you have spaces around the arm. Spaces around the arm देख लो. I'll just draw a slide for you. Spaces around the arm. Another very important topic है ये. ये MCQs में आता है. चलो, I'll just draw this for you. बोलो जल्दी. Spaces around the arm. What is this muscle which begins from the infraglenoid tubercle and comes down here? That's a long head of triceps. Long head of triceps. What is this muscle? Teres minor. ये कौन है? Teres major. Teres minor पीछे गया on the humerus. That's teres minor on the lesser tubercle. Teres major कहाँ जाता है? On the medial lip of the bicipital groove. ये आगे गया on the medial lip of the bicipital groove. बस ये बन गया. This is what you have to know. This is teres minor. This is teres major. And that's a long head of triceps. अब तीन spaces बन गए यहाँ पे. This is one space. This is one space. And this is one space. चलो बोलो. What is number one? Number one कौन है? Number one is the upper triangular space, right? Upper triangular space. Number three is the lower triangular space. तीन है lower triangular space. And what are the contents of lower triangular space? बोल सकते हो? The contents of lower triangular space are the radial artery and, not the radial artery, the radial nerve and profunda brachii. Profunda brachii. radial artery and the profunda, I mean radial nerve and the profunda brachii artery. That's a lower triangular space. Upper triangular space में एक artery होती है, that's a circumflex scapular artery. Circumflex scapular artery. And quadrangular space में there's an artery and there's a nerve. Can anyone tell me what is this nerve and what is this artery? हाँ, very good, Akshat. Quadrangular space का quadrangular space में कौन है? Axillary nerve and posterior circumflex humeral artery. Very good. Posterior circumflex humeral artery and the axillary nerve. This is circumflex scapular. This is circumflex scapular artery. ठीक है. Quadrangular space में quadrangular space में axillary nerve and the posterior circumflex humeral artery. Fine. So just remember this. Just remember this. हाँ. ये dermatomes पे इतना ये नहीं आता है. Now just tell me. See breast अगर आता है ना LAQ, breast is very important as an LAQ. breast आएगा तो पहले आपको extent लिखना है breast का 2nd to 6th intercostal space. हाँ, vertical extent, horizontal extent लिखना है. हाँ, बोलता हूँ. Horizontal extents from the lateral border of the sternum to the mid axillary line, वो लिखना है. फिर then we study the breast under 3 parts. एक है skin, दूसरा है parenchyma and तीसरा है stroma. Skin में 2 चीजें होती है, एक होता है nipple, एक होता है areola. So nipple is a projection. उसमें what opens in the nipple are the lactiferous ducts. Nipple में circular and longitudinal muscles होते हैं. Nipple के बाद comes the areola. हाँ, बोलता हूँ बाबू, बोलता हूँ. Nipple के बाद आता है areola. So areola is a dark space behind the nipple and areola में lactiferous ducts. Areola में there are large number of sebaceous glands which opens and this sebaceous glands becomes enlarged during pregnancy and इसे बोलते हैं montometris tubercles. Montometris tubercles. तो ये बन गया skin. Now comes the parenchyma and then comes the stroma. Parenchyma and stroma. So parenchyma में क्या होता है? The breast is divided into lobes होता है and each lobe has glandular tissue. Compound tubulo-alveolar gland होता है. This gland then converges to the lactiferous duct. उसके पहले एक dilatation होता है, that is known as the lactiferous sinus. Okay, so glands होता है, glands then becomes the lactiferous sinus and there's a lactiferous ducts. And then stroma में you have to write about the connective tissue septa, okay, which extends from the breast to the skin of the breast. These are the ligaments of Cooper's ligament के बारे में आपको लिखना है. ठीक है. So this is how you explain the breast and then come to the blood supply of the breast. The main artery जो breast को supply करती है that is the lateral thoracic artery. फिर superior thoracic thoracoacromial artery, the perforating branches of internal thoracic artery. Fine. And then you come to the lymphatic drainage of the breast. Lymphatic drainage में anterior axillary lymph nodes. These are the main lymph nodes draining the breast. They lie along the anterior wall of the axilla. They lie along the lateral thoracic artery. ये है anterior axillary lymph nodes. The posterior axillary lymph nodes lie along the posterior wall of the axilla. They lie along the subscapular artery. Subscapular artery. So ये है posterior axillary lymph nodes. Anterior हो गए, posterior हो गए. Then comes the lateral group of lymph nodes which lie on the lateral wall of the axilla. Now the lymph from here would drain into the apical lymph nodes and then to the supraclavicular lymph nodes. Okay, so anterior, posterior, lateral, central. Central group है, central, yes. Central group, then apical group and then supraclavicular group. तो ये lymph nodes के बारे में अगर lymph nodes आते हैं तो you have to explain like this. And then you have to write about the clinical anatomy of the breast. हाँ, ठीक है. Clinical anatomy में P2 orange appearance. If the carcinoma spreads into the cutaneous lymphatics, तो P2 appearance, orange appearance लिखना है. Then retraction of the nipple लिखना है if they go into the lactiferous ducts. And ठीक है. And Cooper's ligament, puckering of the skin over the breast. Cooper's ligament involvement लिखना है. The cancer can also go to the ovary, to the abdominal organs through the subperitoneal spread. ठीक है बच्चों? So this is all that you need to know. हाँ, just tell me this. हाँ, ये देखो, this is how the clinic. See बच्चों कैसा है ना, if you know the entire anatomy, हाँ subareolar plexus भी होता है just below the nipple. Yes, subareolar plexus. Bikram, fine. If you know the entire anatomy, clinical सवाल आएंगे बच्चों आपके लिए. हाँ, clinical सवाल, clinical questions आएंगे. So how do you approach a clinical question? Just think and read properly बच्चों. Just see this. अभी इसको answer करिए. Just answer this. हाँ, removal of breast is known as mastectomy. वो आप लिख सकते हो. So I've just told you in short. Athelia, polythelia, amastia. Very good. Very good. Divya. Just answer this. A 30-year-old 7-month pregnant female slowly developed burning pain in the left thumb and the first and second fingers with exacerbation in the night. There is gradual progressive weakness of the thenar muscles with loss of grasping, pinching movements of the thumb. Name the clinical condition. Boliye. That's how the question is going to be. Clinical सवाल very good. This is carpal tunnel syndrome. Pregnant female hai. So what is the cause of this? The cause is ulnar bursitis. Ulnar bursitis. ठीक है. Name the muscles and the cutaneous involvement. ये आपको पता है. ठीक है. So this is how you approach a clinical question. This is what I want you to understand. Answer this. A 35-year-old male was working on a computer in the night shift. He happened to doze off, resting his arm on the back of the chair. On waking up, he experienced severe pain in his limbs. He could not extend his wrist and fingers. Hi, Subhadeep. Hi, good evening, good evening. हाँ, ये क्या है? This clinical condition, very good. This clinical condition is Saturday night palsy. हाँ, इसको बोलते हैं Saturday night palsy. Name the structures involved. Radial nerve. Radial nerve is involved in the spiral groove. Side कहाँ पे? Spiral groove. So radial nerve is involved in the spiral groove because जब अपन ऐसे सोते हैं ना, this posterior aspect of the humerus touches the chair. So name the structure involved. ये होगा radial nerve and the side spiral groove, radial groove. Yes. Name the muscle involved leading to the above condition. तो ये सारे जो muscles हैं, posterior aspect of the arm के muscles, हाँ, so that you have to write. Fine, clear to all of you? So this is how the clinical questions you'll be getting. Ab see, in this upper limb, axilla is a very important LAQ. Axillary, artery भी है, brachial plexus. These are all LAQs. Deltoid पे LAQ आ सकता है. Cubital fossa, yes, it can be an LAQ, it can be an SAQ also. ये जितने भी nerves हैं, median nerve, ulnar nerve, radial nerve, ये सब आ सकते हैं. It will cause wrist drop. Yes, बच्चा आर्यन, it will cause wrist drop. Why? Because spiral groove में injury है ना, spiral groove में injury है तो wrist drop होगा. Spiral groove में injury है तो ECRL will be paralyzed. ECRL paralyzed हो गया तो wrist drop होगा. Hi Ansh, good. I'm happy to see you Ansh. Good. You're answering very well. Then shoulder joint, elbow joint. Shoulder joint, na bachche, shoulder joint, what you have to write, ball and socket type of joint. Then the bones taking part in the formation of the joint लिखना है आपको, glenoid cavity. Deltoid आ सकता है. Deltoid can come as an LAQ. नहीं आता है generally, but I'm just telling you. Glenoid cavity. Yes, you can. Yes, you have to write and practice. Glenoid cavity, head of the humerus. फिर आपको stability के बारे में लिखना है. फिर how is the stability increased by the rotator cuff muscles? वो लिखना है. Then you have to write about the ligaments. Number 1 is the capsular ligament. Number 2 is coracohumeral ligament. Number 3 is the transverse humeral ligament. And number 4 is the glenoid labrum. ठीक है? And then फिर आपको movements लिखना है, flexion, extension, abduction, adduction, medial rotation, lateral rotation, muscles causing this movements. And then clinical लिखना है. So that is how nerve supply, blood supply and clinical. LAQ will under the following heads आता है. So just explain under the following heads. बोलता हूँ बच्चा, बोलता हूँ, just wait. SAQ can come on this muscles. Muscles पे SAQ आते हैं. So pectoralis major, serratus anterior, biceps. Then spaces around the arm पे SAQ आ सकता है. Erb's paralysis, Klumpke's paralysis, then axillary nerve, musculocutaneous nerve, carpal tunnel, snuff box, and carrying angle. Carrying angle पता है ना आपको? The angle between the long axis of the arm and the forearm. That is known as carrying angle. Carrying angle is wider in females because to prevent the arm from rubbing against the pelvis. Carrying angle is wider in females. ठीक है? And why is there carrying angle? Because of the trochlea of the humerus. वो जो ट्रॉक्लिया का मीडियल फ्लैंज होता है ना वो बड़ा होता है, सो देयर इज अ कैरिंग एंगल. हाँ, फर्स्ट मेटाकार्पोफैलेंजियल जॉइंट इज इंपॉर्टेंट. सैडल टाइप ऑफ साइनोवियल जॉइंट है. फिर उसके मूवमेंट्स लिखने हैं आपको, फ्लेक्शन, एक्सटेंशन, एबडक्शन, एडक्शन एंड ऑपोजिशन. ठीक है, एंड देन द मसल्स कॉजिंग द मूवमेंट्स. ठीक है, अरे कुछ गंदा नहीं होता है बच्चे. हाँ, कुछ गंदा नहीं होता है, सब एवरीथिंग इज important, everything is easy, you can download this for a app. हाँ बच्चों, अभी बोलो किसको किसको क्या डाउट्स है. नाउ यू टेल मी. इतना आप पढ़ लो. अल्नार पैराडॉक्स क्या होता है ना बच्चे, देखो जस्ट वन मोमेंट. अगर कोई भी नर्व ऊपर इंजरी होता है सो द इफेक्ट ऑफ लीजन इज मोर. अगर नर्व नीचे इंजरी होता है तो लीजन कम होगा. राइट, सिंपल है ना. इफ देयर इज एन इंप्रेशन अप तो ज्यादा पैरालिसिस होगा, अगर इंजरी नीचे है तो कम पैरालिसिस होगा. बट अल्ना नर्व का रिवर्स होता है, ऑपोजिट है. इफ द अल्ना नर्व इज इंजर्ड एट द wrist, अल्ना नर्व इज इंजर्ड एट द wrist. हाँ, एक मिनट. इफ अल्ना नर्व इज इंजर्ड एट द wrist सो क्लॉ हैंड होगा. इफ अल्ना नर्व इज इंजर्ड इन द फोरआर्म, अल्ना नर्व फोरआर्म में इंजरी हो गया तो फ्लेक्सर डिजिटम प्रोफंडस भी गया एंड दिस एंटायर थिंग इज गॉन, यू गेट अ क्लॉ हैंड. But if the ulnar nerve is injured at the wrist, profundus is spared. Profundus paralyzed नहीं होता, so the profundus will contract and severe claw hand होगा. So when the ulnar nerve is injured at the wrist, जो claw hand होगा, that is going to be a severe claw hand. Then when the ulnar nerve is injured in the forearm, and this is what we call as ulnar paradox. समझ में आया बच्चों? सिंपल है. सी अल्ना नर्व जब wrist पे इंजरी होती है ना तो प्रोफंडस इज स्पेयर्ड. ये जो प्रोफंडस स्पेयर होता है ना, इट कॉजेस अ सीवियर क्लॉ हैंड. दैट इज इट. समझ में आया? दिस इज अल्नार पैराडॉक्स. जनरल एम्ब्रियो आई कवर समवेयर एल्स. हाँ संजीव, जनरल एम्ब्रियो में क्या क्या करना है देखो आपको. एक तो प्रिमिटिव स्ट्रीक करना है. प्रिमिटिव स्ट्रीक. Cubital tunnel syndrome is compression of ulnar nerve between the two heads of flexor carpi ulnaris. Ulnar nerve is behind the medial epicondyle. Medial epicondyle से जब ulnar nerve आगे आ जाता है ना, आगे it passes between the two heads of flexor carpi ulnaris. And compression of ulnar nerve between the two heads of flexor carpi ulnaris is known as cubital tunnel syndrome. हाँ, वन शॉट्स करता हूँ बच्चे. प्रांजलि, वन शॉट्स ना. न्यूरोएनाटमी इंपॉर्टेंट क्वेश्चंस में होगा. न्यूरोएनाटमी इज अ सेपरेट टॉपिक, हेड एंड नेक इज अ सेपरेट टॉपिक. अपर लिम्ब, लोअर लिम्ब, हेड एंड नेक, न्यूरोएनाटमी, थोरैक्स, एब्डोमेन, ऐसे 6 टॉपिक्स है. हाँ, जो इंपॉर्टेंट टॉपिक्स है अपन कवर करेंगे. ठीक है बच्चों, बट दिस इज अ रिवीजन लेक्चर, तो इसमें है ना there's a everything in a nutshell, a quick revision. बच्चों अभी मैंने कैसे रिवाइज किया, दैट इज हाउ यू शुड बी एबल टू रिवाइज. हाँ, एग्जाम के पहले यू नीड नॉट रीड इन डिटेल्स, बस रिवाइज करो. जैसे अभी मैंने कैसे रिवाइज किया, दैट इज द वे यू शुड बी एबल टू रिवाइज. हर एक एलएक्यू का मेन चीजें याद रखना. डोंट रीड द एंटायर एलएक्यू फॉर बिफोर एग्जाम्स. जस्ट मेन थिंग लाइक शोल्डर जॉइंट, तो ये ऐसे याद रखना एंड देन उसको एलॉबरेट करना है. यू हैव टू एलॉबरेट. प्रैक्टिकल विल बी आफ्टर दिस थ्योरी. ये थियोरी लेक्चर्स होने के बाद प्रैक्टिकल के लेक्चर्स होंगे. आर्यन, अभी बोला ना मैंने. आर्यन, आई जस्ट टोल्ड यू व्हाट इज अल्नार पैराडॉक्स. अभी बोला ना, लीजन्स ऑफ अल्नार नर्व एट द wrist causes a severe claw hand than the lesion at the forearm. I just told you this. I just told you. हाँ, और कुछ डाउट्स है किसी को? समिन, हेड एंड नेक इज अ सेपरेट टॉपिक. हेड एंड नेक अलग टॉपिक होगा. बाबू सिंह, दैट इज फाइन. पेपर 1 अच्छा था ना बाबू सिंह, दैट इज फाइन. हेड एंड नेक इज नॉट इन द स्केड्यूल. रहेगा संजीवन, I'll put that head and neck, I'll put in the schedule. It will be there. Head and neck is an important topic. हाँ, मेन टॉपिक्स खत्म करेंगे। और कुछ डाउट्स है किसी को? हाँ, ये है ना, ऐसे रिवीजन होता है बच्चों। सी, जो नए स्टूडेंट्स है ना, नए स्टूडेंट्स, इट विल बी डिफिकल्ट टू अंडरस्टैंड दिस। जिसने अभी पढ़ा है ना, एंड यू आर गोइंग टू रिवाइज एवरीथिंग नो इन अ नटशेल, दैट इज इट। क्वेश्चन पेपर्स प्रीवियस ईयर्स के प्रैक्टिस करो ना बच्चा, प्रीवियस ईयर के प्रैक्टिस करो। नीट यूजी एस्पिरेंट, स्टडी हार्ड एंड आ जाओ मेडिकल में to come and sit for the lectures then. Anastomosis around the scapula. देखो बच्चों, बस एक याद रखो, उन्नो जस्ट अंडरस्टैंड। नहीं, पास्ट ईयर के पेपर्स देखना, बाकी के कॉलेजेस के प्रीलिम्स के पेपर्स देखना, एंड पास्ट ईयर के पेपर्स देखना। Anastomosis around the scapula is between the first part of the subclavian and the third part of axillary. बस यही याद रखना, फर्स्ट पार्ट ऑफ सबक्लेवियन एंड थर्ड पार्ट ऑफ एक्सिलरी। थर्ड पार्ट ऑफ द एक्सिलरी में सर्कमफ्लेक्स स्कैपुलर आती है, फर्स्ट पार्ट ऑफ सबक्लेवियन में सुप्रा स्कैपुलर आर्टरी आती है, सुप्रा स्कैपुलर आर्टरी। यस, एनाटॉमी इज वेरी इंपॉर्टेंट फॉर सर्जरी। अगर एनाटॉमी परफेक्ट है, यू विल बी अ एक्सीलेंट सर्जन। हाँ कृष्णा, कृष्णा व्हाट हैपेंड बच्चा, क्या हुआ? डिटेल्स में कहाँ पढ़ा ये बताओ दो अब। हाँ, डिटेल्स में कृष्णा, व्हाट आर यू डूइंग? हाँ अभी बोलो कृष्णा, अभी व्हाट आर यू डूइंग? अच्छा, वेरी गुड बाबू सिंह। ओके ग्रेट। कृष्णा, यू कैन रीड फ्रॉम द पीडीएफ, मेरे लेक्चर्स के पीडीएफ पढ़ सकते हो आप। यू कैन ऑल्सो रीड द बुक्स, है ना, बीडीसी विश्राम सिंह का स्टैंडर्ड बुक्स है, प्रारंभ बैच के पीडीएफ्स भी है। हाँ, embryo is awesome बच्चे, embryo is awesome. If you understand embryo, you will understand the gross very well. जनरल एम्ब्रियो में प्रिमिटिव स्ट्रीक है, प्लासेंटा है, ये सब मेन चीजें करो। क्लैविपेक्टरल फेशिया इज इंपॉर्टेंट, मैंने करा क्लैविपेक्टरल फेशिया, आई हैव डन, मैंने करा है क्लैविपेक्टरल फेशिया। फर्स्ट पीजी प्रिपरेशन, फर्स्ट ईयर पीजी प्रिपरेशन, अभी नीट पीजी है ना 30th of August को, नीट का फर्स्ट ईयर पीजी बैच। देखते हैं आर्यन, विल सी दैट, हाँ देखते हैं। ओके, थैंक यू सो मच टू ऑल ऑफ यू, थैंक यू सो मच। हाँ, थर्सडे को विल हैव अ क्विक रिवीजन ऑफ लोअर लिम्ब। हाँ, यस यस कृष्णा, हाँ यूट्यूब पे भी देख सकते हो। हाँ, आई हैव गॉट लेक्चर्स ऑन यूट्यूब ऑल्सो, वो भी आप देख सकते हो। हाँ, नीट क्रैकर एम्ब्रियो में देखो, एक तो प्रिमिटिव स्ट्रीक कर लो, प्रिमिटिव स्ट्रीक, एमनियोटिक कैविटी करना है, योल्क सैक करना है, ये I'll explain this somewhere else, हाँ, दूसरे कोई लेक्चर में I'll explain. Yes, you can complete anatomy in 20 days, you can complete, ठीक है। फिर प्लासेंटा कर लो, प्लासेंटा इज वेरी इंपॉर्टेंट, एंड विलिस, कोरियोनिक विलिस, ये कर लो। फाइन, I'll take that in some other lecture, कोई और लेक्चर में will do that, don't worry, ठीक है। यस आर्यन, yes, anatomy for this year प्रारंभ batch will begin from end of September or from October. जयशु, पहले पढ़ा है ना? एनाटॉमी इज वास्ट है, इसलिए डिफिकल्ट लगता है, बट इफ यू नो हाउ टू स्टडी, हाउ टू अप्रोच इट, इट इज ऑसम, यू लव द सब्जेक्ट। वीडियो ऑन इंपॉर्टेंट क्वेश्चंस लिखा ना मैंने बच्चे, आई हैव टोल्ड यू दिस आर ऑल द इंपॉर्टेंट क्वेश्चंस, ये सब इंपॉर्टेंट क्वेश्चंस है, इतने कर लो, ठीक है। थैंक यू सो मच एंड बाय बाय टू ऑल ऑफ यू, गुड नाइट एंड विल मीट ऑन थर्सडे विद द लोअर लिम्ब, ठीक है। सब पढ़ के आना बच्चों, से रिवीजन के लिए आते हो ना, तो यू हैव टू रीड एंड कम, पूरा आपका मतलब यू हैव टू हैव अ थरो नॉलेज, दिस आर जस्ट रिवीजन लेक्चर्स, आई कैन नॉट गो इनटू डिटेल्स ऑफ दिस, डिटेल विल बी प्रारंभ बैच के लेक्चर्स, ठीक है। तो जो भी बच्चे फर्स्ट टाइम सुन रहे हैं, तो दिस इज जस्ट लिसन टू दिस इज द रिवीजन लेक्चर। दिस फरे विल गो ऑन फॉर दिस मंथ, ये मंथ में फरे खत्म हो जाएगा। बाबू सिंह, थैंक यू. यस, बाय बाय, थैंक यू, बाय बाय. 20 मार्क्स का नहीं आता है बच्चे, 20 मार्क्स का नहीं है, 15 मार्क्स का आता है मैक्सिमम. LAQ 15 मार्क्स. ओके, बाय बाय, आई विल स्टॉप, थैंक यू.